A warm good evening to everyone. Hope you are doing great. Vrutta presents Chatushtaya 2023, a national seminar with paper and poster presentation. And I welcome each and everyone to this 3-day paper presentation. First of all, I would like to invite our most respectful panel members, and I invite the panel, Dr. Sri Lakshmi S.G., Dr. and Dr. Shankaraj. Next, I would like to invite Panchakarma panel, Dr. Pramila K and Dr. Sukanyasa. Now I invite Dravyaguna panel, Dr. Sridevi and Dr. Shija. Now I invite Kaumaramurtya panel, Dr. Srija Ashok, Dr. Ramya and Dr. Ansipa. Let's invite Samhita panel, Dr. Veena Vijay, Dr. Rashmi A and Dr. Krishna Priyasi. I invite Nidhana Tantra panel, Dr. Srilada Soman, Dr. Nitya R and Dr. Arya K. Now I invite Dr. Kumari Velayathan, Dr. Kavita and Dr. Ashwini K. Now let me invite Swastha, Dr. Shilpa and Dr. Kirti. I Madhava, Vinita S and Dr. Surya Chetak. I invite Manasika panel, Dr. Nitin Darade and Dr. Umar Jadhav. Now let me invite Shalakya panel, Dr.
Thank you, Dr. Aishwarya. Let me invite our first presenter, Dr. Arya A R, on the topic Ojus. Dr. Arya. Dr. Arya, please unmute the doctor.
Hello, can you hear me?
Yes, doctor.
Okay.
Can you please share the screen, doctor?
Hello.
Your screen is visible, doctor. Please start the session.
Okay. Good evening, everybody. Myself, Dr. Arya A R, final year PG scholar, Department of Kriya Sharira, Government Ayurveda College, Kannur. Welcome to my presentation. I am here presenting the topic Ojus. We all know that the Ojus is considered Prana Ayatana Uttavam. Ojus is the body entity which lodges the prana. According to Charaka, Deshiva Ayatana Prana Yeshu Pradishtidaha, Shango Marmatrayam Kando, Rektam Shukro, Ojisi Gudam. Charaka considered Ojus as one among the Desha Prana Ayatana. Ayatanani va Ayatanani, the Dupakade, Pranopudada, Tanashocha, Prana Nashadi Kyataha. According to Susruda, Resadinam Shukrandanam Dadunam Yet Param Tejaha, Tat Gulu Ojisaha. It is the excellence of all the 7 Dadus. The synonyms of Ojus include Bala, Sneha, Prasada, Sara, and Rasa. Ojus in Veda. Tejomasi Tejomayi Dehi, Virямasi Viryamayi Dehi, Belamasi Belamayi Dehi, Ojovasi Ojomayi Dehi. The term Ojus is mentioned in the Yajurveda also. This is the Ojo Poshana. Pushpiri to Ahara Resad, Resarudira Mamsa Medo, Asti Majja Shukra Ojansi. It gets nourished from the Ahara Rasa in the same way all the Dadus are nourished. Next is the site of Ojus. According to Bhela, Tanani Dwadasha Bhavandi, Tadyada, Shonidam, Mamsam, Medo, Asti Majja Shukra, Shukra Ojansi, Sweda, Pitta, Sleshma, Mutra, Budishani. Ojaha, Sarva Sharirastam, according to Sharangadara. Next is the type of Ojus. It is two.
Arya.
Excuse me, sir, can you hear?
Yes, doctor.
So can you hear me?
Yes, doctor. The screen is also
Okay,
good, doctor. Please continue, doctor.
okay. Okay, next is the type of Ojus. It is mainly two types, para Ojus and apara Ojus. Hello. There are mainly two types of Ojus. It is para Ojus and apara Ojus. And the site is considered para Ojus, it is heart, and apara Ojus is whole body. And the quantity is 8 drops, and apara Ojus it is Ardhanjali. And the color is Ishat Rekta and Ishat Pida. And the color is, according to apara Ojus, it is Sarpi Varna. And taste of apara Ojus is Madhurasa. And the functions is the para Ojus is sustains of life, and apara Ojus provides strength and nourishment. First one, the para Ojus, Parasis Vishtasya, which is the principal type, and it is originated in the intrauterine life of an individual. And the quantity is Ardhanjali is Vaishmanasya Ojasaha. Para Ojas is 8 drops and Abara Ojas is considered half Anjali. Next is the qualities. Ojas Omatmadam Snikdam Shuklam Shidam Stiram Saram Viviktam Mrudu Snikdam Cha Pranayatana Muttamam. According to Susprada, it is considered as Pranayatana Muttamam. And according to Sharaga, Guru Shidam Mrudus Leshnam Bahalam Maduram Stiram Prasanam Pichilam Snikdam Ojo Desha Gunam Sradam. Sharaga mentioned the 10 qualities of Ojas. And Sarpi Varnam Madhurasam Laja Gandhi Prajayade, Hridi Tishtari Shuddham, Rektam Ishasta Pedagam. The order it is Laja Gandhi, Rasa is Madhurasa, and qualities is Snigdha, Shida, Stira, Rasa, Mrisna, Prasanna, and Pichila. And the color is Sarpi Varna, Ishat Lohida, and Ishat Pida. Next is the formation of Ojas. Pradamam Ide Hojaha, Sharire Asmin Sharirina. Ojas is formed from the commencement of the life itself. Yet Sara Madhu Garbhasya. एतद् गर्भरसाद्रसः संवर्तमानं हृदयं समाविशति यत्पुरः भ्रमरैः फलपुष्पेभ्यो यदा सम्प्रीयते मधुः तदोजः शरीरेभ्यो गुणैः सम्प्रीयते नृणाम्. As the bees collected honey from the fruits and flowers, so the ojas is maintains the body of the human being by the virtue of its gunas. The honeybees collect the honey from different varieties of flowers and fruit and deposit at one place, which is wax. And similarly, the ojas is also collected from all the tissues of the body and deposited in one place known as the Hridaya. Next is the circulation of Ojas. Ojas is circulated through the Siras. Deshamula Sira Hristaha Sarvam Sarvado Vapuhu. Resasmagam Vahan Yojaha Tani Baddam Hi Sheshvidam. It is present in the heart and is circulated the whole body with the help of 10 great vessels attached to it. Next is the function. Ojastu Tejo Dadunam, Shukram Danam Param Smridam, Hridayastam Abhivyabi, Dehastidi Nibandanam, Snigdam Somatmakam Shuddham Nishat Lohita Pedagam, Yen Nasho Niyadam Nasho, Ismin Tishtadi Tishtadi, Nishpadiri Edo Bhava, Vivida Deha Samstaya. The substantial essence of all the 7 dadus ending the Shukla Dadu is termed as Ojas, and though it is located in the Hridaya, it spreads all over the body and maintains, and it is a Snigdha, Shida, and is pure and appears to be the slight reddish yellow in color, and the destruction definitely leads to the destruction of the individual and the presence in the maintenance of life. And Ojas as Ubadadu, Charaga, the Ojas is Ubadadu of the Shukradadu, and according to Ashtanga Sangraha, Ojas is considered the Shukrasara. Next is Ojas as Mala, Ojo Dadunam Kramasho Malaha, Etat Ojaha Sarva Dadunam Tejaha Sharir Sampavam, the Shukrasya Maraha. Ojas is referred as Mala of Shukra in this context. And the Ojo Vigaras it include Trayo Dosho Balasyogtaha Vyabhat Vishramsa Lakshayaha. The Ojo Vishramsa, Ojo Vyabhat, and the Ojo Shaya. First one is the Ojo Vishramsa. It is the displacement of Ojas due to the injury, etc. Sandhi Vislesho Gatranam Sadanam Dosha Chevanam Kriya Sandhi Rodasha Vishramse. Vislesha Sado Gatranam Dosha Vishramsanam Samaha Apracharyan Kriyanam Chabala Vishramsa Lakshanam. And looseness of joints, weakness of the body, and displacement of the dosha, and the improper expression of all the body movements and the fatigue. Next is the Ojo Vyapat. Sabda Guru Gatrada Vada Shofo Varna Vedo Glani Sandra Nidrasha Vyavani. Gurutam Sabdada Angesho Glani Varnasya Vedanam Sandra Nidra Vada Shofo Vala Vyapati Lakshana. The lakshanas include stiffness and feeling of heaviness of the body, edema caused by Vada dosha, discoloration, exhaustion, stupor, and more of sleep. Next is the Ojo Kshaya. Mucha Mamsakshayo Moha Pralabo Marana Vidishakshaye. Mucha Mamsakshayo Moha Pralabo Apnana Mevasha Puroktani Shalingan Maranam Shabalakshaye. According to Sharaga, Vivedi Dubbalo Abhishnam Yayade Videndriya Duchayu Durbana Duksha Vavishamasha Takshaye. The Ojas, which is repeated due to anger, hunger, constant thinking, grief, exertion, etc., and which is leads to phobiasis, loss of strength, and the excessive thoughts, sensory disturbances, and the loss of complexion, confusion, increased dryness of the body, and the exhaustion. Next is the causes of Ojus. It includes Abhigada, Kopa, Shoga, Dhyana, Smara, Shudaha, Ojaha, Samshriya Dehibhu, Dadu Grahana Nisradam, Tejaha, Samirita Tasma, Visam Shedik Sheha, Ojaha Shede, Kopa, Shudyana, Shoga, Samadhibihi. Injury of the body, loss of the tissue, anger, grief, worry, exertion, and hunger. Next one is the Ojo Vriddhi Lakshana. Ojo Vriddho Ki Dehisya, Tushti Pushti Belo Deha. It includes the Tushti, Pushti, and Bela. And the physiological significance which include that which is responsible for the Ojus is the entity which is responsible for Yadi Shamatwa, which helps in the maintenance of homeostasis of the body along with the balanced dosha. And the instability of Ojus, it is seen in the 8th month of the Garbha. Ojo Astirida is seen. The Ojus is travel from the mother's heart to the fetus heart, takes place. And when it is in the mother's heart, when Ojus is in the mother's heart, the mother is looking happy, and when it is in fetus heart, and the mother is looking exhausted. The conclusion: Ojus is the essence of all the dadus, neither included in dosha, nor dadus, nor mala. It is the most important entity that regulating the functions of dosha and other organs as well as the substance of life, and it is responsible for defense mechanism also. Thank you.
Thank you, Dr. Arya.
Thank you.
So let me invite Dr. Ashwini Kolur for the next presentation.
Dr. Ashwini.
Yes, sir. I'm just sharing my screen.
Okay, sir. Your screen is visible, Dr. Ashwini. Please start the session. We can't hear you also. Please unmute.
Hello. Hello.
Yes, doctor.
Okay.
Yes, sir. Am I audible? No.
Yes, doctor, you're audible. Please start.
Yeah. Let me start today's topic, that is Bhagandara in clinical practice with respect to dosha analysis in the process of healing. Myself, Dr. Ashwini S. Kolur, completed my BMS and post-graduation in psychology and counseling, post-graduation in childcare health, and Ayush yoga instructor. Now I am a student of Shalakya. Today's contents of presentation: introduction, objectives, methodology, conclusion, and review of literature. Introduction. Modern science has grown, but still in management of fistula, it's great challenging. Because of its recurrence, this is called for innovative technique to be incorporated from Ayurveda to tackle the disease Bhagandara. Although fistula in ano is not a life-threatening emergency, it is of serious concern with regard to pain, persistence, purulent discharge, etc. Hence, Acharyas mentioned this as the Ashtamahagada. But when we see day-to-day practice, in patient of Bhagandara, process of healing is variable from one person to one person because of the dosha, dhatu, agni bala of a patients. Hence, the study is undertaken to elicit doshaja analysis. Objectives of studies: to assess the dosha analysis in the Bhagandara and its role in post-operative healing process. To differentiate the duration of healing, comparative study between patients who underwent only Kshatrakarma and Shastrakarma and the patients who took dosha treatments along with the Shara and Shastrakarma is taken. Let me see the definitions of Bhagandara. Acharya is told that Bhagecha Dara Avyaktam is called as Bhagandara. Means that which is having the tear in anal region is called as Bhagandara. It is an abnormal tract with an external opening in the perineal area that is communicating with the rectum or an anal canal by identified by internal opening. Great surgeon of ancient time, it's called as Bhagandara. What are the Samprapti Vigatana? What are the causes? Nidanas are Mithya Ahara, Agantuja Karanas like horse riding, improper sitting, obesity, excessive coitus, etc. In dosha involved is vata, anubandha dosha is pitta and kapha, dusha is mamsa and rakta, and adhisthana is guda. Shatkriya kala of Bhagandara. Sanchaya avastha, the excessive accumulation of doshas in the hip or it's called, and because of the doshas accumulated, sanchaya is happened. And the next is prakopa avastha, in which the aggravation of the doshas happened. Next, a prasara, spread of the doshas all over the body. Now the sthana samshaya, dosha samurchana takes place, and now the disease possible. Vyakta stage, in which the lakshanas will be seen. Now the last stage is Veda, there is a complication will be seen in this stage. Now, what are the types of Bhagandara? Vataja Bhagandara, it's called as Shataponaka, Pittaja is Ushtagriva, Kafaja is Parisravi, and Sannipatja is Shambhukavarta, and Aguntuja is called as Unmargi. According to Acharya Sushruta, these are the 5 types. And Acharya Vagbhata has mentioned other 3 types of Bhagandara are Vata Pittaja Parikshepi, Ruju, and Arsho Bhagandara as the Dvandvaja Bhagandaras. So how do we manage the fistula in different state of avastha? In the stage 1, what we do is we differentiate the avastha of the Bhagandara. That is, if it is a apakva avastha or the pakva avastha. Later stages, we start our medicines with the preventive measures, adjacent measures, parasurgical measures, as well as the surgical measures. Like if it is an apakva avastha, as soon as the swelling of anal region is detected, it should be dried and cleansed, and the patient is allowed for the apatarpana, that is to give a light that or the next we can give the patient virechana or the raktamokshana can be given. Later, vata patra lepa can be given. In the stage of pakva avastha, there are some measures to be taken, like some preventive measures also helpful for the Bhagandara, that is Guru, Madhya, Asatmya Ahara, Viruddha Ahara, Vishama Ahara to be avoided, and some viharas like strenuous exercises, excessive coitus, anger, uncomfortable riding, suppression of natural urges to be avoided. Internally, some of the medicines like Saptamishtika Gugulu, Nimbadi Gugulu, Abhayarishta, Aragvadadi Avaleha, Arogyavardhini Vati, Avipatikara Churna, which helps for the improving digestion, cures constipation, reduces formation of gas, and provides relief from the pain, which also prevent further recurrence of the diseases. Some supportive measures like adjuvant therapies like Avagaha Sveda, with a Trifala Kota or the Ishtimadu or the Panchavalkala, Varti insertion with many of the Arka Vartis, application of Kalkas, application of Kashaya, some of the application of Tailas, and some of the Matra Bastis can also will be helpful as an adjuvant therapy. Like in Shodhana Karma, as I already mentioned, Virechana can be prescribed for the patient during the apakva avastha of the stage of Bhagandara. And when the Basti can be used for the Matra Basti for the post-healing process of the Bhagandara. Now, very importantly, Shara Karma, which is a special treatment for the Bhagandara, which is a gold standard technique used by the Ayurvedic surgeon for the treatment of Bhagandara. It can be done by using the Sutra, Varti, Pichu, local application in the form of paste is done. Helps in management of wound removing plaques. And as well as the Kshara Sutra, it is a important part of our Bhagandara. That is, Shara has always been used as adjuvant to the surgical procedure in Bhagandara, but the Kshara Sutra owes the credit of standing as a complete treatment of Bhagandara without the add of any other operative procedure. And Shara Sutra provides adequate treatment to the anorectal disease very effectively. Recurrence rate in a fistula in ano is negligible as compared to conventional treatment available. These procedures are minimal, painful, and more effective, and as well as acceptable scientific treatment. And also, if it is not treated by the Kshara Karma or the Shara Sutra, next we can go for the Shastra Karma with the Chedana Karma. Also, you can do the fistulectomy. And after post-operative, we can do the Panchavalkala decoction with the dressing of Shatadauta Grita. Now, let's see the different methodology adopted. We took 5 patients of Bhagandara in a group A to elicit another 5 patients of Bhagandara in a group B with a similar complaints. And a group A people we treated with a Kshara Karma and Shastra Karma without post-operative treatments according to the doshas. Wherein in group B, we treated Kshara Karma, Shastra Karma along with the post-operative treatments with respect to their doshas. Patient 1 with a complaints of no pain, only pus discharge was there, edema was not there, tract size was below 5 centimeter, Shara Sutra was introduced, and the patient in second patient we also has all the complaints like below 10 centimeter, Shara Sutra was induced. Along with the same way, all the patients we introduced depending on their complaints. Just we conclude here that Shataponaka, which is having the many symptoms like pain, constipation, multiple tract, compared with the Vataja, Bhagandara, and the Daha pus discharge is compared with the Ushtagriva, and the person which is having edema, dull lake, white purulent discharge called as the Parisravi, Bhagandara, and the mixed features having all three doshas is called as a Shambhuka Vrutta, Bhagandara. So in the treatment schedule for the group B patients, same complaints, but we have given along with the Shara Sutra, Matra Basti and Pranapurna with the Taila, like Anutaila can be given, Dhupana is done, and to also advise patient to not to use Vataja Ahara Viharas. And in the patient of Pittaja Bhagandara, we told them to use the Lepa of Yashti Mattu and Sariva Kalka and Panchavalkala Kvata Avagaha is told, Garta application is told. In the same way, Dosha Samurchana has been, analysis is done along with the treatment. In the patient of mixed features, we have given the Kshara Sutra ligation with the Matra Basti with the Parisheka. And in the patient of, because the patient has come for us after the post-operative case in the fistulectomy, and the patient of 5, which is having the multiple track, with the Matra Basti, we have given him a application of Kalka as well as the Matra Basti as well as the Avagaha Sveda. In this way, when we compare a group of A patients with a group B patients, we can see the difference here. Patient with the A, when the only Kshaраkarma and Shastrakarma had taken a longer duration to heal, wherein with the patients having the Doshaja analysis along with the Kshaраkarma and Shastrakarma, they some parasurgical treatments are advised for them, and some supportive treatments also advised according to the dosha analysis. This way it had helped. So some of the other treatment we can apply for the Vataja Bhagandara is also told, like Vranapurna with Nishadi Taila, Saptanga Gugulu, some internal medicines also can be divided by seeing the symptoms of the patients. So in this way, we can conclude that by our case study, as seen in a group A patient and group B patient, as like without post following up care, dosha assessment, it would take long time to heal. But if the proper assessment of dosha is done in an initial stage and post follow treatment is given according to the dosha assessment, means healing could be much more faster. Hence, types pathogenesis as per Shatkriya Kala, onset and progress, Purva Rupa, Rupa, stage-wise management, and even the complication of Bhagandara has been perfectly explained by the Acharyas. Despite various advancements made in the surgical management of fistula and ano, Ayurvedic methods of healing remains more authentic and reliable because of the low reoccurrence rate, better recovery, and a lower chances of incontinence. Ayurveda can heal a better way. Review of literature is also told here, and the reference of Bhagandara in Samhitas are also told. Thank you.
Thank you, Dr.
Ashwini.
Shini.
So next I invite Dr. Jayesh.
Good evening, ma'am.
Good evening, doctor.
Yes, ma'am. Can I share my screen, ma'am?
Yes,
Sure, doctor. Please share the screen. Okay.
Okay.
Dr. Jayesh, you have any problem with screen sharing, doctor?
Can you see that, sir?
Your screen
Can
is
you...
not visible, doctor.
Sorry, sir. 1 second.
If you have any problem with screen sharing, I'll share for you, doctor.
Oh, please, sir. Please share, sir.
Okay.
Screen is not coming here.
Doctor, please chat the session, doctor.
Okay. Yeah, thank you, sir. Thank you. Sir, in play mode, sir. Thank you, sir. Okay. Thank you. Hello, sir. Good morning, one and all. Good evening, one and all. I am Dr. Jayesh, studying third year MD in Karnataka Ayurveda College, Mangalore. My topic is relevance of Dushi Visha concept in practical aspect of carcinogenicity. Okay. Etymology of Dushi Visha. Dushi is altered, denatured, attenuated, latent, or vitiated. Visha means poison. It is derived from the word dush, which means polluting or defiling. Dushi Visha is any kind of poison originating from inanimate or animate sources of any artificial poison, Kritrima Visha, retained in the body after partial expulsion or which has provisionally undergone detoxification by the anti-poisonous drugs, fire, the wind, or the sun. Actually, how the Dushi Visha formed is mentioned in Charaka Samhita Ashtanga. Jeernam Vishagna Ushadipi Hadamba, Devagni Vadadaba Soshtamba, Sobhavado Vaso Grunarna Yuktamba, Dushi Vishabhyam Vishamapi Virya. Jeernam partially metabolized any type of Visha, Savara or Jangam or Kritrima, which is not completely eliminated from the body or partially detoxifying and being deposited and accumulated in the body at various those tissues producing cumulative effect. Next is Dava Agni. Exposure to intense heat and fire alters the property of Visha, resulting in reduced potency and its hence leading to the formation of Dushi Visha. Poisonous substance causes the detoxifying process to get accelerated and reduces the potency of the poison. Exposure to Vada. Exposure to the Shidala Vada, cold wind dries up the water content of Visha and reduces some of the natural properties like Tikshna, Ushna, etc. and makes it less potent. Exposure to Adava. Exposure to sun rays, especially UV radiation, which disinfects air, water, and even poison. It means partial detoxification by antidotes or antitoxic therapeutic agents, resulting in partial metabolism of poison, which also retains some properties. Sopavada va guna viparidanam. Less than 10 properties, it can become Dushi Visha, that is of low potency by nature. Due to low potency of this poison, it won't prove fatal, but also due to enveloping Avaran action by the Kapha, this low potency poison is retained in the body for a long period without producing any grave or fatal symptoms. Next is the definition of carcinogens and carcinogenic agents. I'm actually trying to compare this Dushi Visha effect on carcinogenicity. Actually, these are slow type of poisons which causes, how they causes carcinogenicity in our body. This is a definition of carcinogens. Can be of chemical carcinogen, radiation carcinogen, or microbial carcinogen. Steps involved in carcinogenicity is bioactivation, interaction with the macromolecules, initiation, promotion, combustion, and propagation. First is initiation, results from exposure of a cell to a sufficient dose of carcinogenic agent. Initiator, an initiated cell is altered, making it potentially capable of giving rise to a tumor. Initiation alone, however, is not sufficient for tumor formation. Initiation is not only causes this carcinogenicity, but some other steps are also involved. Initiation causes permanent DNA damage, therefore it is rapid and irreversible and has a memory. Mainly two types of irreversible initiation are there. There are direct initiation. Acting agents require no metabolic conversion to become carcinogenic. Indirect is acting agent requires metabolic conversion to an ultimate carcinogen before they become active. Mutation, of course, throughout the genome and cell by chance suffer damage to oncogenes and tumor suppressor genes. Some carcinogens interact with particular DNA sequences and produce mutations that are clustered hotspots. Commonly mutated oncogenes and tumor suppressors such as RAS and P53 are particularly important targets. Example, aflatoxin produce mutation to P53 gene. Next step is promotion. Promoters, they are called promoters. Can induce tumor in initiated cells, but they are non-tumorigenic by themselves. In contrast to the effect of initiator, the cellular changes resulting from the application of promoter do not affect DNA directly and are reversible. Tumor do not result when the promoting agent is applied before rather than after the initiating agent. Some examples compared to these type of initiators and promoters compared to Dushi Visha. These are some examples which we can directly quote it to the Ayurveda. UV radiation from sunlight causes non-melanoma, skin cancer, and basal cell carcinoma, cumulative exposure, and causes melanoma, continuous exposure to UVB, most carcinogenic. This is directly initiator. UV radiation can be considered as the initiator, and which is the cumulative effect will give rise to cancer. It is mainly, we can compare it to the Dushisha. Cumulative usage of oral contraceptives and hormonal therapy can cause CA, cervix, and breast cancer. Aflatoxins produced by Aspergillus fungi present in peanuts and tree nuts, maize, etc., mainly in warm and humid area, causes hepatocellular carcinoma. This is one time or two time exposure to aflatoxin. We do not cause cancer. If it continuously exposed, which will cause the toxinogenicity again and again, and it will lead to hepatocellular carcinoma. This is also like Dushi Visha, which is accumulated like that only. Cumulative exposure to asbestos causes mesothelioma, rare cancer, also cancer to larynx and ovary. Alcoholic beverages. These are the actually alcoholic beverages are example for secondary carcinogenic. Not direct, it is indirect, because if you consume alcohol more, it will cause the production of acetaldehyde in your body, which is a potent carcinogen in the form of acetaldehyde. Either alcohol is not a potent carcinogen, but it converts into acetaldehyde, it causes a potent carcinogenic effect. Alcoholic beverages are classified by IARC as group 1 carcinogen. In female, alcohol causes breast cancer, colorectal, larynx, liver, and pancreatic cancer. Main carcinogenic effect is the formation of acetaldehyde by the breakdown of ethanol, a potent carcinogen. Cumulative poisoning of arsenic long-term exposure. If somebody is exposed to arsenic daily, or somebody exposed to arsenic long-term, it is there by 1 or 2 times. By long-term exposure through drinking water and food and tobacco chewing, long-term exposure can cause skin cancer, bladder and lungs. International Agency of Cancer Research (IARC) has classified arsenic and arsenic compound as carcinogenic to human, and has also stated that arsenic in drinking water is carcinogenic to human. This is also like our Dushi Visha. It is accumulated day by day. Regular use of red meat and processed meat, group 1, causes colorectal cancer. This is a direct evidence. It is a direct carcinogen. Red meat was classified as group 2A, probably carcinogenic to humans. The classification based on limited evidence on epidemiological studies showing positive association between eating red meat and cancer. Although these results are small, they could be important for public health because many people worldwide eat meat, and meat consumption is increasing in low and middle income countries. Thank you.
Thank you, Dr. Jayesh.
Thank you, sir.
Next, I invite Dr. Mayuri Madhukar for the paper presentation. Dr. Mayuri, are you there?
Hi, yes, sir, I am here. Hello.
Please share the screen, doctor. You are audible, doctor. Please share the screen.
ठीक है, sir. Hello.
Yes, doctor.
Ma'am, can you please share my PPT?
Okay, doctor.
Dr. Sabin. Just a moment, doctor.
Mayuri, please start the session, doctor.
Thanks, sir. Next. I am W.r.t. Madhukar Parjane, third year scholar MD Kai Chikitsa, SVNST Ayurved College, Rahuri, guided by Vaidya Prashant Yavatkar, HOD and Associate Professor, SVNST Ayurved College, Rahuri. Next. My title is Non-communicable disease and its prevention. Introduction. Non-communicable disease accounts for a large and increasing burden of disease worldwide. NCDs, also known as chronic disease, are medical conditions that are associated with long duration and slow. Most NCDs are non-infectious and are the result of several factors, including genetic, physiological, environmental factors. According to WHO, NCDs are the leading cause of death worldwide, responsible for 71% of total number of deaths each year. The top 4 killers among NCDs with highest number of deaths are cardiovascular disease, cancer, respiratory disease, and diabetes. The 4 main types are cardiovascular disease, cancer, chronic respiratory disease, diabetes. Other types are hypertension, dyslipidemia, obesity, metabolic syndrome, rheumatoid arthritis, cerebrovascular disease, osteoporosis, osteopenia, degenerative disease, neurodegenerative disease. Risk factors for NCDs. Risk factors are classified as modifiable and non-modifiable factors. Modifiable factors involve high blood pressure, smoking, diabetes, physical inactivity, obesity, high blood cholesterol. Non-modifiable risk factors are age, gender, genetic factor. Non-modifiable risk factors can also classified into 3 classes: biological factors, behavioral factors, and social factors. Genetic factors, genetic factors are family disease history, genetic inheritance, epigenetic changes, environmental exposure based, example radiation, toxic material based mutation. Environmental factors are air pollution, weather changes, UV radiation. Socio-demographic factors, age, gender, education, income. Factors of self-management, tobacco use, alcohol use, physical activities, person's weight, food choices, and dental health care. Diet and lifestyle. In the past, infectious and parasitic diseases were the main cause of the death, but in the recent decade, NCDs have replaced them and have become the main cause of death. This may be attributed to change of diet habit and lifestyle over the year, which can be classified as a shift of disease pattern in humans. Additionally, the high consumption of processed meat and sugar-sweetened beverages combined with other unhealthy lifestyle factors such as high body mass index, physical inactivity, smoking have a marked association with NCDs. Cardiovascular disease. Cardiovascular disease are leading contributors to the global burden of disease among the NCDs and accounts for the most deaths worldwide each year, even more than the number of deaths from cancer and chronic respiratory disease. CVDs are group of disorders that are not only related to heart conditions such as ischemic heart disease, stroke, congenital heart disease, coronary heart disease, cerebrovascular disease, peripheral arterial disease, and rheumatic heart disease, but also blood vessels that involve hypertension and condition associated with cerebral, carotid, and peripheral circulation. While CVDs equally affect both sexes, men suffer from higher incidence than women. Still, CVDs are the leading cause of death of women in developed countries. According to American Heart Association, there are 7 key factors and behaviors that contribute to increasing risk of heart disease and stroke: nutrition, smoking, overweight, physical inactivity, uncontrolled blood pressure, elevated level of cholesterol and blood sugar. Most CVDs can prevented by these addressing by these 7 risk factors. Involves healthy diet, regular physical activity, avoiding smoking and second-hand smoking, reaching and maintaining a healthy weight, and keeping blood pressure, cholesterol, blood sugar level under control. Cancer is the main public health problem and second main cause of the death. The cause of cancer can be classified into 3 categories: biological carcinogens, chemical carcinogens, and physical carcinogens. According to WHO report in 2018, the most common cancer are lungs, breast, colorectal, prostate, skin, and stomach, while the most cancer deaths are from cancer of the lungs, colorectal, stomach, liver, and breast. The guidelines for oncological disease prevention and early detection are based on cancer risk assessment, including past medical history, lifestyle factors, family disease history, and genetic testing. Lung cancer, which is the most common cancer in the world, is mainly the result of smoking, and the risk increases in heavy smokers. Several studies reported low intake of fruits, vegetables, and related nutrients in lung cancer patients. It is possible to prevent lung cancer by stopping the prevalence of smoking and by increasing fruit and vegetable consumption. Furthermore, dietary habit and physical activity contribute to breast cancer, which is the second most common cancer in the world and the most common cancer among women. Excess adipocyte and hormonal mechanism appear to play a role in breast cancer progress and are affected by dietary intake during childhood and adolescence. Hence, maintaining a healthy weight throughout life can minimize the chances of breast cancer. Another type is strongly associated with diet is colorectal cancer. High intake of meat and fat, low intake of fruit and vegetable dietary fiber, vitamins and minerals are related to increased risk of colorectal cancer. Hence, minimizing consumption of meat, especially preserved meat, can reduce the risk of this cancer. Chronic respiratory disease. CRDS covers wide range of disease in the airways and the structure of the lungs. Most of the morbidity and mortality of CRDS is increased with age. CRDS include chronic obstructive pulmonary disease, occupational lung disease, asthma and respiratory allergies, sleep apnea syndrome, and pulmonary hypertension. Genetic and environmental factors are the risk factors of CRDS. Environmental factors are more dominant. These factors include air pollution exposure, including tobacco smoke and second-hand tobacco smoke, indoor and outdoor air pollution, occupational exposure, and socio-economic factors. Thus, following a healthy lifestyle in the early age of life, avoiding respiratory infection, and avoiding environmental and occupational agents can effectively prevent CRDS. Diabetes mellitus. Diabetes mellitus is not only chronic disease but also an acutely life-threatening condition. Further, it may causes serious disease such as heart disease, kidney failure, and eye damage, which may subsequently leads to blindness, foot ulcer, which may require limb amputation. The main two types of diabetes both leads to hyperglycemia. Type 1, the pancreatic beta cells cannot produce a sufficient amount of insulin. Type 2, the body cells cannot respond properly to insulin. Other type of diabetes involve gestational diabetes mellitus, which occurs in pregnant women with glucose intolerance, and type 3 diabetes associated with Alzheimer's disease, where neurons in the brain cannot respond to insulin. Lifestyle changes can prevent diabetes and long-term complications of diabetes. Patients with type 2 diabetes can control or even reverse the diabetes by changing their lifestyle and eating habits. Management of risk factors. The most common cause of NCDs are metabolic and behavioral risk factors. Recent evidence suggests that a diet that is high in healthy fat and rich in unsaturated fatty acid prevent the development of metabolic diseases and reduce cardiovascular events. Lifestyle activities include healthy diet and focus on limiting the use of salt, sugar, and saturated fats. Management of NCDs. At the global level, who design policies and strategies to reduce the risk of NCDs, it is important to monitor NCDs and to assess their progress at the national, regional, and global level. The WHO offers help to smokers who have the desire to stop using tobacco products and to implement rules to propose a smoking-free environment. Several low-cost and highly effective strategies are available to prevent and manage NCDs. For example, encouraging people to play sports for physical activity is the most effective factor that can easily influence the prevention of NCDs. Interventions are used in public health management in an effort to promote good health behavior, implementing multi-sectoral actions to prevent NCDs, including school health program, national cancer control program, national trauma control program, national tobacco control program, etc. Strategies of NCDs, global level, design national policies and plans, support and encourage research for NCD and prevention and control, monitor NCDs, support national and international partnership for NCDs prevention and control, country level.
Excuse me, Dr. Mayuri.
Yes, ma'am.
Doctor, you are exceeding the time limit. Please make it fast.
Okay, ma'am. Country level, improve budgetary allocations to support primary health system. Next, society level, offer healthy food in the workplace, offer opportunity to physical activity in the workplace. Individual level, follow healthy lifestyle. And conclusion, in modern society, NCDs are the main challenge in healthy health system. Risk factor management is essential in the NCD management. Modern strategy for the management of NCD should be oriented towards the individual level, where the individual is responsible for their health by simply following a healthy lifestyle. Government and international organizations should make people aware of their health and their environmental to make the world a safe and healthy place. Okay, ma'am.
Thank you, Dr. Mayuri.
Thank you.
So next, I invite Dr. Bajrang Prabhakar for the paper presentation. I invite Dr. Bajrang.
Yes, madam.
Doctor, you are audible. Please share the screen, doctor. Hello, Dr. Bajrang.
Yes, sir. Yes, sir.
Please share the screen, doctor.
Okay, sir. सर शेयर नहीं हो रहा है.
Doctor, if you have any problem with screen sharing, I will share for you, doctor.
तो शेयर नहीं हो रहा, वो इधर दिखा रहा है.
Hello, Dr. Bajrang Pawar.
No error
Doctor,
दिखा रहा है. Yes, sir.
Doctor, we will share for you, doctor. Doctor.
हाँ. Yes, sir. Good evening, sir. सर आवाज आ रहा है. Hello.
Please start the session, doctor.
My presentation topic is the diagnostic view in Grahani Roga. Next, introduction. Grahani Roga is a chronic disease. While explained in our classic, we refer to classic
after Garbhini due to vibration of Agni. Garbhini Roga is the prime disease of gastrointestinal tract, among which are most often found in our day. Garbhini Roga is usually eight major diseases, which is hard to diagnose, difficult to cure. Garbhini and Agni are having Adhara Adriya Sambandha. Later Agni rules the process of digestion supported by the three doses. Garbhini is the disease due to chronic imbalance of their three doses, which impact function of tetragamy. To make a diagnostic approach of Garbhini Roga, use the help of generalized features, clinical features, and Malapariksha to differentiate different types of Garbhini Roga. Materials and methods. Material has been collected from ancient Ayurvedic research journal and electronic database. In this article, it would have been made a collect various captured data related to Garbhini Roga and diagnose the disease easily. Next, what of Garbhini Roga? Guru Shikha Atiruksha Sangushta Bhajan, Nichya Yoga or Panchakarma, the root of disease, Pramistana, Veda Vidharana, Atimanchana, Bajrang, Veda Vidharana, Ati Bhajanatha or Bhajanatha, Kal or Ritu Viparya. Next, Nidan. Variation of Agni can't digest one liquid amount of food. Undigested food gets fermented, ajna from the Shmuruga, Kurcha, Rama, etc. Vatajaroga, Pitta, Daha, Krishna, Mukaroga, Amla Pitta, Rajachma, Vinas, Prameha, Dhatugat disease, Shakrit. Garbhini Roga disease, Agni, next Agni Dushi, Agni Mandya, Ajula, and Atisara. Next is Garbhini. Diagnosis of Garbhini Roga, do you get balanced quantity of food and digest within proper time? Called the samadhi. Do you feel that even after taking less amount of food, you can digest? Yes, mandagi. Do you feel that does those one to consume at a proper time? How you boil, ultra boil with water constipated, it's called Gargi. Grahani. Adding with the sub Grahani Roga, Pati Suttam Dhamma Dhavam Satu Chate, Oktoba Sarujam Puti Muru Dam Grahani Roga Mahavi Samayurvedam Jana. Next, type specific character और generalized symptoms दिए हैं गर्भिणी के specific character में जो वात है उसे flatulence after and during digestion पित्तज में sore eruption दिया है कफु जो गर्भिणी रोग है उसमें heaviness and stillness of abdomen generalized symptoms में dryness of throat, mouth, hunger, thirst, bitterness, neck vision, pain, weakness of परिकर्तिका इसमें वो जो गर्भिणी रोग है उसमें एनोरेक्सिया, excessive thirst, sore eruption, burning, मस्तक दाह जो कपज है उसमें nausea, vomiting, एनोरेक्सिया उसमें sweetness of mouth, cough, rhinitis, it is ऐसे दिए और संग्रहणी है एब्डोमिनल जो सिम्टम्स है वातज के वो फूड डाइजेस्ट विद डिफिकल्टी सुप्तपाका आणि विसूचिका पित्तज में इधर कोई नहीं जाए कफज में फूड डाइजेस्ट विद डिफिकल्टी संग्रहणी में इंटेस्टिनल गार्गिंग दिया है कैरेक्टर्स ऑफ स्टूल जो वातज में जो स्टूल के कैरेक्टर है वो पास स्टूल with difficulty that is liquid mixed with hard stool. पित्तज में watery, undigested, bluish, yellowish in color. Kafaj में stool not well formed but broken into pieces mixed with ammonia and mucus and are heavy. संग्रहणी में watery, cold, solid, with arm pass with the sound. The discussion we had session of the dosh lakshana. Yes, what type of Grahani doshaj symptoms did the patient suffer in of the Purvarupa before manifestation of the clinical pictures of the like Krishna, alias does the patient present with the clinical pictures of the Roga, Murmu, Badam, Murmu, Dravam, try to find out types with their cardinal features, abdominal features, nature of stool, and generalized symptoms. Does the patient have angina for longer duration? After consideration the above question, we have proceeded to make principles of conclusion में after proper evaluation of agni armor सामान्य लक्षण and विशिष्ट लक्षण we can diagnose Grahani Roga in proper way to proceed for successful treatment. This is a different case. Thank you.
Thank you, doctor.
Thank you, sir.
Next, I invite Dr. Soumya Pandey for the paper presentation.
Yes, sir.
Dr. Soumya,
Yes, sir. Yes, sir. I'm here.
please share the screen, doctor.
Yes, sir.
Your screen is visible, Dr. Soumya. Please start the session.
Yeah. Is it visible, sir?
Yes, doctor, visible.
Good evening, respected sir and ma'am. I'm Dr. Soumya Pandey. I'm a PG final year student of Shalakya Tantra department studying in PDA College of Ayurveda. Today's my topic of presentation is the importance of Swastha in Shalakya Tantra. So Shalakya Tantra is one of the 8 branches of Ayurveda which deals with the disease, means disease situated Udvajatru, that means above clavicle, like ear, eye, ear, nose, throat, dental, head and neck. So Kai Bal Graha Udvang Shalya Drashta Jara Vishan. In this, Udvang means related to Shalakya Tantra, that means Udvajatru. Ancient classics like Charak Samhita, Shushruta Samhita, Ashtang Hridaya have mentioned Swastha important for every person's health. Swastha is made up of 4 things: Dinacharya, Ratricharya, Ritucharya, and Sadvrut, which affects the health of human beings, especially Chakshurendriya, Shrutendriya, Granendriya. So in this presentation, I'm going to describe how Swastha plays an important role in Shalakya Tantra. So we will start with Dincharya. Dincharya means waking up early in the morning, Brahma Muhurt, that is called as Brahma Muhurt. Brahma Muhurt is 1 to half an hour before sunrise. So benefits are the person does not feel lazy. It helps to promote focus, concentration, and alertness, and it is the best time for gaining knowledge. Achman means sipping of water in early morning with the help of mantras, means 1 sipping for each mantra. Benefits: it removes all the ills of the body and mind. Danta Dhawan means tongue cleaning. Danta Dhawan means tooth brushing, tooth cleaning. So for Dant Dhawan, twig should be of 12 angul length, and the twig should be crushed at one end and then chewed slowly. In this figure, in this image describes twigs. This is blunt at one end. Benefits are Indriya Prasannata, secretion of cough and khed. It removes vitiated cough and bad odor and also makes the gum stronger. It's also a good exercise of facial muscles. So contraindications of Danta Dhawan are Kandashul, Galarog, Chhardi, Ajirna and Ardit. In this disease, the patient is not advised to do Danta Dhawan. Jiva Nilekhan. After Danta Dhawan, tongue scraping is advised. As Jiva is site of Bodha cough, so tongue scraping should be done after toothbrushing. In our classics, metallic tongue scraper made of Suvarna or Rajat is recommended. It should be curved without sharp edges. Benefits: it helps to cure bad breath, it removes germs and mucus from the mouth, and it increases salivation. So Netra Prakshalan, that means eye washing. It plays an important role in Shalakya Tantra. So washing the eyes with Lodra or Amal ki Kwat help in maintaining the constant clear vision. Anjan means collyrium, or some pigment or collyrium is applied from Kaninak Sandhi to Apang Sandhi, that is from inner canthus to outer canthus, with the help of Anjan Shalaka. The Anjan Shalaka should be of 12 angul length. Then it is important because eye is seat of Tej Mahabut. So Kaph dosh is responsible for eye disease. So to protect the eye from cough, Anjan is applied. One should close his eyes and rotate the eyeball for proper spreading of Anjan in the whole eyes. Anjan recommended in Dincharya is Savir Anjan and Rasanjan. Savir Anjan is should be applied daily, some Nitya Dincharya, should be done for Nitya Dincharya, and Rasanjan should be applied only on 5th and 8th day. Benefits of Anjan: eyes become clear and bright, improvement of eyesight. Contraindications are the person who is suffering from fever, headache, or who has taken Vaman Virachan Karma. In this person, Anjan is contraindicated. Dhumpan means medicated smoking. It is done with the help of Dhum Yantra. Taking of medicated smoke of medicinal plants through the mouth or nose and releasing it through mouth, call it Dhumpan. It is mostly given in Kaphaj Rog and disorders of Shiro, Karna, Nasa, Mukh, Dant, Vaksh, and Dey. It plays an important role in Shalakya Tantra. Benefits: makes mind stable and peaceful, voice becomes soft and pleasant. Disease like halitosis, anorexia, lockjaw, rhinitis, sinusitis, baldness, hoarseness of voice, earache, goiter can be cured. Contraindications are pregnant women can't take Dhumpan, head injured patient, poisoned after taking Vaman and Virachan. The picture shows W.r.t, first picture, and second shows the procedure of how to take Dhum using Dhum Yantra. Nasya. Nasya is also important therapy for management of disease of Shalakya Tantra, as Nasa is considered at Shirodwar. So the medicine is administered through nose either in the form of tails, Varas, or Churna. So among 5 types of Nasya, Pratimash Nasya is recommended for Nitya Sevan, I mean for Dincharya. So 2 to 3 drops of medicated oil should be instilled in both the nostrils in supine position with the head slightly tilted backwards. It is advised in the age group of 80 to 80 years. Benefits in the disease like Vata, Shiroroga, Dhabhedak, Karna, Shul, Keshpat, etc. Some common oil that is used are for Nasya. In case of Adhabhedak, Shadbindu Tel, Anu Tel can be used. Contraindications: the person who has recently taken Vaman or Virachan, pregnant woman, injured person who has taken food, and the person who has taken poison or alcohol and who is tired. This is the this image shows how to instill drops in nose. This is the position. Kaval and Gandush. Retention of any liquid, medicated oil or decoction in mouth is known as Kaval and Gandush. The difference between Kaval and Gandush is that the retained fluid, which can be easily rotated in all the directions of oral cavity, is known as Kaval, and when such movement is not possible, is called as Gandush. Face should be kept little high while during this procedure. It is kept in mouth till sweating from forehead and secretions come out from nose and eyes. It is used in treating of Shiro, Karna, Nasa, Mukh, and Dant Rog, used to treat Prasek, helps in proper identification of taste. Some common dravyas used for Kaval and Gandush are mouse ras. Mouse ras is recommended for daily use for Dincharya, Kaval and Gandush. Grete Shir, Dhanya Amla, Kalka. Dhanya Amla is used in case of if their patient is suffering from dryness of mouth. Contraindication is Kaval. It is contraindicated in those who are suffering from Madatya, Shosh, Raktapitta, and Kupitakshi. Karna Puran. Lukewarm Swaras Grut or Kwat Gomutra is put into external auditory canal, is known as Karna Puran. Either we can use spoon or dropper can be used for this treatment. Matra is in Swastha person 100 matra 2 to 3 minutes, or in Karnrog 100 matra. In Shiro Rog it can be extended to 500 matra. Contraindication is if there is a rupture of tympanic membrane, ear injuries, or burns that affects ear. Vyam, the action of body which gives strength, is Vyam. But here, while talking about in Shalakya Tantra, we focus more on eye exercise like palming, blinking, near and far focus. This exercise improves eye strain. Shiro Abhyanga, the process in which the head is gently massaged with medicated oils. Oil used are Til Tel, Shirbala Tel, Mahamashtel, etc. Benefits: the person gets relief from Shirushul, Darunak, Vakvikar, Anidra, Vatrakop, etc. Contraindication: if someone is having pregnancy or menstrual cycle after taking Vaman Virachan, or who is suffering from flu, chills, or acute fever. Padabhyang is massaging of oils in soles of both feet is known as Padabhyang. For general foot health, Tiltel and Gogrut is advised. If some person is suffering from palmar fasciitis, then in that case we can use Istika Sved and Dashmul Kwat. So benefits are our classics means Stang Hriday identifies 4 major nerves in the feet that connects to the eyes. Those nerves helps maintain good eyesight and relieve eye strain when subject to Padabhyang. So benefits of Padabhyang are cure Sera Sankoch, Snayu Sankoch, pass foot and heal the contraindication septicemia, thrombosis. Snan, it removes sweat and dirt from the body. It's a basic procedure. So taking a head bath with hot water is not recommended by Acharya because it is harmful for eyes. The person should use always cold water above the clavicle and below the clavicle. Sukhoshna gel is used to promote longevity. Ahar, always we should eat after digestion of previously ingested food and according to Agni Bal. Some Patya Ahar for Chakshushi Ahar are given here. Dhanya Varg, Raktashali, Haritaki, Triphala. Bhagbhat has recommended Jivanti, jungle mouse. Chhattarhar means wearing umbrella turbans to protect the upper part of the body from direct sunlight, dust. It is also good for eyes. Padradharan means wearing footwear, protects against foot disease. It is also beneficial for eyes. Ratricharya here is activities and regimens
Dr.
to be followed
Soumya?
during. Yes, ma'am.
Doctor,
Just
you are
a minute,
exceeding the
ma'am.
time limit.
Just a minute, ma'am. Yeah. So either भोजन उत्तर कर्म, पानी प्रक्षालन, दंत शोधन, मुख प्रक्षालन, तांबुल सेवन is given, and one should do all these things during Ratri Charya. Nidra is also a very important factor in Ayurveda. It's one of the Trayopstamba. The Ratri Swabhav Prabhav Nidra is considered best. Ritu Charya. The Sharirik Shodhan Karma, Vaman Virichan depends on the season. One has to take elimination therapy to maintain the normalcy of Chakshurendriya, Shodhendriya at regular intervals of time. So while if the person suffering from Pitta Jabishand, so in that case Virichan should be done, and in Sharad Ritu only. Sadruti, these are the basic personal and social code of conduct that one should follow. Benefits of Dinacharya is given: release of stress, digestion, absorption, discipline, pace. These are the references. Thank you.
Thank you, Dr. Soumya.
Thank you, ma'am.
So next I invite Dr. Bhuvaneshwari Patil. I invite Dr. Bhuvaneshwari.
Ma'am, myself, Dr. Manjula, I'm a friend of Bhuvaneshwari. Hello, is it audible, ma'am? Yeah,
Yes, doctor,
ma'am, she's not able to connect through her Bluetooth. Please, can you call her up after 2 to 3 presentations?
Okay, doctor.
Yeah.
So now I invite Dr. Manjula.
Yeah, ma'am, myself.
Okay, doctor.
Yeah, ma'am,
Doctor, please start.
Yeah, can you share the PPT, ma'am, please?
Just a second, doctor.
Yeah.
Dr. Manjula,
Yes, sir.
please start the session, doctor.
Yeah. Yeah. So can you put it on the presentation mode? Yeah. Thank you, sir. A very good evening to the respected jury members. Myself, Dr. Manjula, and title of the presentation is a literary research translation of manuscript on Bala Chikitsam Ravanamate. I belong to the Department of Samhita Siddhanta, and these are the contents of my presentation, that is introduction, aims and objectives, review, discussion, conclusion, and references. So next slide, please. Yeah, introduction. Ancient manuscripts are witness of glorious past, well-developed science and literature of Indian culture. The study, teaching, and practice of any scientific discipline are dependent upon its literature. The Indian medical heritage is extremely productive. It has produced the largest corpus of medical manuscripts in the world. These are scattered all over the country. Presently available medical texts which are in use now are only 2% of medical literature, which were present previously in manuscript are lost now. They deserve the value and importance in research field, which is the need of an hour to reserve them and to preserve them. So next slide, please. Yeah, so there is a utmost need for the conservation of the medical manuscript. So thinking over this, I have selected a topic that is a manuscript by name Balachikitsam Ravanamati, which is coded as a K489, and it was selected for my PG work because it was an unpublished literature and hidden knowledge to the world for the contribution of Ayurveda literature. And this was translated into English language because it can reach to the common people so that they can understand the concept of Balagraha. And the objectives of the studies were, first one was to collect and digitize the selected manuscript Balachikitsam Ravanamate K489. And second objective was to translate the selected manuscript into language English. Review. The review, when we see the Balagraha manuscript, I have gone through this, and the manuscript Balachikitsam Ravanamate is a work which is dealing with the concepts of Balagraha. In this manuscript, totally 12 grahas were explained, and each graha is explained with the time of its attack and its lakshana and chikitsa. Chikitsa is explained based upon the modalities of Dayavapashasik chikitsa, such as Bali, Snana, Dhupana, Mantra for each graha. And when we see the script, in that the starting lines were written by the name of Parshvanatha Namoha. Next slide, sir. So materials and method for the literary study, materials required were collected from the catalogue of the manuscript, and the selected manuscript was digitized copy, which was selected from the Kuvempu Institute of Kannada Studies, Mysuru. And for this work, I have used many Shabdakoshas. Next slide, please, sir. Yeah, methodology. The study was based on the manuscript Balachikitsam Ravanamate, and here first the digitization was done and followed by transcription and transliteration, and it was collected from the ORI from Mysore, and the second copy was collected from the Kuvempu Institute of Kannada Studies, Mysuru. Next, sir. Discussion. First, the method followed was transcription. Transcription means to write the text as it is on the paper. So here this manuscript matter was typed as it is, as doing the transcription is helpful for reading the manuscript in a very easy way. And next comes the method of translation. That is, the contents of the selected manuscripts were copied as it is, and meaning-based English translation of all the shlokas was done. English translation of technical terms were not done. And this is the manuscript which I have got. Next slide, sir. Next slide, please. Yeah. And in this manuscript, we get the matter like on 12th day, 12th month, or 12th year, child gets attack of Sandana Nama Matraka Graha, and which they have specifically told for 1 year if he gets attacked by some Graha, the name of that Graha, and the symptoms of that Graha, and the chikitsa of that Graha. Everything was detailedly told in that manuscript. Next, sir. So next slide, please. Yeah, and date and authorship of the manuscript was not available. And about the scribe, as we have seen in the last slide, that the author has started writing this manuscript by using Lord Parshvanatha Namaha. So I have done Anumana by using Anumana Pramana. We have come to a conclusion that the author or the scribe was belonging to Jain Sampradaya. And about the language of the manuscript, the language is in Sanskrit, but the lipi is in Kannada. Reason, the scribe may be well versed with Kannada lipi than Devanagari lipi. Next slide, sir. Conclusion, the field of medical manuscriptology opens the door to know the hidden knowledge of Ayurveda. To popularize the concepts of Ayurveda globally, English language is selected for translation, and this manuscript was selected to bring the concept of Balagraha to the limelight. Thank you, sir.
Thank
These
you,
are the
Doctor.
references. Yeah. Thank you, ma'am.
Now I invite Dr. Sri R.Nair for the next presentation.
Yes, ma'am. 1 minute.
Dr. Sri?
Yes, ma'am. Yes, ma'am. 1 minute.
Okay, Doctor, please share the screen and start.
Am I visible, ma'am?
Yes, Doctor, it's visible now.
Okay. Good evening, all. Myself, Dr. Sri R.Nair, second year PG scholar, Department of Shalya Tantra, Amrita School of Ayurveda. I am here to present on topic a clinical observation on crustacean consumption and its relation to inflammatory arthritis under the guideship of Dr. Shaitya and Dr. Rajeshwari PN, Department of Shalitantra, Amrita School of Ayurveda. We are moving on to the introduction part. Inflammatory arthritis refers to any type of arthritis caused by an overactive immune system caused by intake of prawns, crabs. Unlike osteoarthritis, inflammatory arthritis affect people of age, often in early adulthood, affecting several joints at the same time. Inflammatory arthritis can be diagnosed by its clinical features and by rearrangement of blood parameters. By avoiding crustacean consumption and by providing judicious treatment, we can prevent the progress of inflammatory arthritis into persistent inflammatory synovitis, leading to permanent damage to cartilage, bone, and joints. Hence, here an attempt is made to treat young adults suffering from inflammatory arthritis with the combined treatment of Amavata and Vadarekta. Delay in diagnosis and initiation of treatment can significantly impact on prognosis. Moving on to the patient description. A 23-year-old patient complaining of pain in the inguinal region since 3 years. The patient was asymptomatic before 3 years and gradually he felt aching type of pain in the left inguinal region. The pain was radiating to left leg and it aggravates on doing physical activities like walking. Then he underwent allopathic medication and he got symptomatic relief. The pain was insidious by the consumption of seafood like crabs, prawns, etc. And later pain was not relieved with allopathic management. Past history of the patient, past histories of increased serum IgE, history of gynecomastia which was surgically corrected, allergic to seafood. Baseline findings, swelling present, pain present, limitation of movements present. Blood investigation like increased ESR, CRP, and serum IgE suggest inflammatory arthritis. Moving on the investigation, lab investigation like complete blood count with the histogram, ESR, CRP, serum IgE, and MRI. The MRI of the patient showed that moderate synovial effusion with the thinning of articular cartilage and minimal joint space narrowing noted on the left side with a few subchondral cystic changes and minimal marrow edema involving left acetabulum. Possibility for inflammatory arthritis to be ruled out. These are the blood investigation report. Before treatment, the ESR level is 37 mm per 1 hour. CRP level is 11.6. After 14 days of treatment, the ESR level reduced into 20 mm per hour and CRP level drops into 8.46. Before treatment and after treatment comparison, before treatment ESR level is 37 mm per hour and after treatment it reduced into 20 mm per hour and CRP level 11.6 and it after 40 days of treatment it reduced into 8.46 mg per dl and hemoglobin level is also increased for 0.46 mg per dl. The treatment principle, he was treated with the combined treatment principles of Amavada and Vadarekta. Internal medications we are given Rasna Saptam Kashayam, Mahamanjishtadi Kashayam, 25 ml each twice daily before food, and Yogaraja Gugulu 1 TD before food, Kaishwara Gugulu 1 TD before food, Amavada Hari Rasa 1 TD after food, and Tab Neo is a patent drug 1 BD after food. The external medications we are given Dashamula Kashayadara in 2 days, Danyamaladara for 3 days, and Virajana with the Gandharva Astadi Erandam, Erandamula the Niruvati for 3 days, and Anivasanavasti with the Gandharva Astadi Eranda Tailam, 75 ml for 5 days, Sarvanga Bingaman and Adi Swedam with the Danundra Tailam for 4 days, Jambiravinda Swedam with the Kotanjukadi Tailam for 4 days, and Ubanaha with the Jadamayadi and Dasnadi Churna for 10 days. The progress of the treatment, midpoint findings. After first set of treatment, the patient feels better with the considerable relief and symptoms. Swelling got partially reduced and the pain subsided and movement is become normal. But again, the condition is reoccurred by the intake of seafood and hence the patient was advised for the complete restriction from seafood. Endpoint findings show that by 14 days of treatment and complete restriction of crustacean food, CRP and ESR values become normal with symptomatic relief. Discussion and conclusion. Patient residence and food habit plays a major role in disease manifestation. He was treated with the combined principles of Amavada and Vadarekta, which include Abhyanga, Swedana, Sneha Virejanam, Ruksha therapy, Sega, and Vasti. Here, Dashamula Kashayadara, Danyamaladara, Ruksha therapy, and Shmudara action. Virajana helps for Srodho Shodhana and Vasti as Vadashavana and strengthening of Asti and Sandhi. Internal medications give Vadashavana and Vadarektahara properties. At the time of discharge, he was stable with a normal CRP value and reduction in signs and symptoms. Thank you. Thank you, Madam. Patient listening. Thank you, ma'am.
Thank you, Dr. Sri R.Nair.
Thank you.
Next, I invite.
Thank you, doctor.
Thank you. Thank you.
Next, I invite Dr. Vanitha Shankar Rao for the paper presentation. Hello, Dr. Vanitha Shankar Rao, are you there?
Yes, sir. Yes, I'm here.
Okay, doctor, please share the screen, doctor.
Share screen.
The screen is visible, doctor. Please start the session.
Okay, sir. Good evening, everyone. Myself, Vanitha Shankar Rao Munde, MD Carcinogenicity scholar, SVNSTS Ayurvedic College, Rahuri. Guide, Jyoti Chopde, ma'am. My topic is titled Psoriasis, Understanding and Managing Chronic Skin Condition. Introduction. Psoriasis is a chronic autoimmune skin condition characterized by rapid skin cell turnover and inflammation. Causes a rash with itchy, scaly patches, most commonly on the knees, elbows, scalp. Important of raising awareness about psoriasis to promote understanding and support for individual living with the condition. Etiology of psoriasis. Immune system role. The immune system becomes deregulated, leading to an abnormal immune response. Genetic factor. Certain genetic variation and mutation are associated with an increased risk of developing psoriasis. Environmental trigger, infection, injury, stress, smoking, alcohol, medication such as lithium, beta blocker, anti-malarial and non-steroidal and anti-inflammatory drugs. Types of psoriasis, plaque psoriasis. The most common types characterized by raised red patches covered with silvery scales on the skin surface. Gutted psoriasis present as small red scaly lesions that resemble drops, often triggered by bacterial or viral infections. Pustular psoriasis involve the formation of pus-filled blister on the skin, accompanied by redness, tenderness, and flaking. Inverse psoriasis affect the skin folds such as the groin, armpits, and beneath the breasts, causing smooth red patches that worsen with friction and sweating. Erythromatic psoriasis, a severe form where large areas of the skin become red, inflamed, and exfoliate, often accompanied by itching pain and increased heart rate. Pathophysiology, etiological factor, genetic and environmental. Patches of psoriasis on the skin growing faster than normal skin. Deregulated inflammatory response with large production of various cytokines. Then superficial blood vessels dilated and vascular engorgement. Then epidermal hyperplasia and improper cell maturation. They fail to release adequate lipid, which lead to flaking, scaling, presentation of psoriasis lesion. Then silvery scale of the skin appear. Clinical presentation of psoriasis. Symptoms. Typical symptoms of psoriasis are red patches of skin with silvery scale, itching, inflammation, and sometimes pain. Impact on quality of life. Physical and emotional impact of psoriasis like social stigma, reduced self-esteem, and psychological distress. Diagnostic criteria. Process of diagnostic psoriasis involve physical examination, medical history review, and occasionally a skin biopsy. Important of medical evaluation. It is important to seek medical assessment to differentiate psoriasis from other skin conditions with similar symptoms such as eczema or fungal infection. Treatment options. Topical treatment. Use topical corticosteroid, vitamin D analogs, retinoids, and moisturize for managing mild to moderate psoriasis symptoms. Ayurveda offers treatment for psoriasis including detoxification therapy called panchakarma, herbal remedies such as neem, turmeric, gugul, aloe vera, and manjista. Dietary and lifestyle modifications. Ayurvedic medicines like rasayanas or blood purifiers, and the external therapies like oil massage and herbal paste. This approach aims to clean the body, reduce inflammation, and promote skin healing. Systemic treatments use oral medications such as methotrexate, cyclosporin, and acetylene for moderate to severe psoriasis. Biological therapies. Role of biological therapies, including their mechanism of action, indication, and potential side effects. Phototherapy, use of phototherapy options such as a narrowband UVB and PUVA for managing psoriasis symptoms. Lifestyle management, it is important to follow of stress reduction techniques, maintaining a healthy diet, avoiding triggers, regular exercise, proper skincare, sun protection, and the use of moisturize. Psychological and emotional impact. Psychological burden, impact of psoriasis on mental health, including increased risks of anxiety, depression, and decreased quality of life. Important of support, significance of psychological support, counseling, and self-care practices to manage the emotional impact of psoriasis. Resource and support groups provide information on available resources such as patient advocacy organization and online communities for individuals with psoriasis. Recent finding here, IL-23, IL-17 axis, gut microbiome, psoriasis arthritis, genetic markers, lifestyle factor. Here some recent finding about the psoriasis. Patient education and self-care. Self-care tips, provide practical tips for managing psoriasis such as keeping the skin moisturized, using mild cleanser, avoiding triggers, and following prescribed treatment plans. Flare-up management. Second, flare-up management. Explain strategies for managing flare-ups, including stress reduction techniques, proper skincare, and adherence to prescribed treatments. Empowering patients, encourage patients to actively participate in their treatment journey and seek regular medication care. Conclusion. In conclusion, psoriasis is a chronic autoimmune skin condition characterized by red, scaly patches that can cause physical discomfort and have a significant impact on a person's quality of life. Diagnosing psoriasis accurately and understanding its trigger and experting factor is essential for effective management. Treatment options including topical medication, systematic therapies, and phototherapy, alongside lifestyle modification, supporting individuals with psoriasis through education, empathy, and psychosocial supports can help alleviate the emotional burden associated with the condition. Increase awareness and compassion are key to improving the lives of those living with psoriasis. Here's some reference. Thank you, sir.
Thank you, Dr. Vanita.
Okay.
So next, I invite Dr. Aparna S for the presentation.
Yes, ma'am. Can I share the screen?
Yes, doctor.
Stop.
Ma'am, is it visible?
Yes, doctor, it's visible.
Okay, ma'am, can I start?
Yes, doctor, please.
Good evening, everyone. I'm Dr. Aparna S, second year PG scholar from the Department of Tantra, Amrita School of Ayurveda. I'm here to present a case study on preventive management of Barrett's esophagus, a single case study under the guidance of Dr. Soumya Mohan, Assistant Professor, Dr. Rajeshwari PN, Professor, Department of Tantra, Amrita School of Ayurveda. Introduction. The lax less, that is the sphincter tone is very loose in case of people with GERD. This will result in the regurgitation of the gastric juice, causing irritation in the esophageal mucosa. This can lead to a condition called Barrett's esophagus. It is a pre-malignant condition with high incidence of transition to adenocarcinoma. The clinical features were classified according to the dosha predominance to help plan the treatment. Barrett's esophagus. This condition is that the lining of esophagus changes and become more like that of the large intestine. This condition is considered to be pre-malignant, and this can sometimes change into adenocarcinoma. It is caused by the chronic inflammation resulting from the gastroesophageal reflex. This is due to the dysplastic changes occurring in the esophageal mucosa. pathology behind the occurrence of Barrett's esophagus is that there can be Vada Vaigunya, causing the regurgitation of the gastric fluid, that is gastroesophageal reflex, and causes the Pitta Vriddhi in the esophagus. This Pitta Vriddhi can lead to changes in the esophageal lining, resulting in Barrett's esophagus. Moving on to the case study. Here is a patient who is 30 years old, female, who is non-diabetic and non-hypertensive, presented to the OPD with retrosternal pain, burning sensation, nausea, vomiting, and epigastric tenderness as symptoms since 1 year. The methods used is a single case study. Protocol for treatment is Vadanulomana and Pitta Shodhana. The duration for treatment was 5 months, and evaluation measures used is endoscopy. This table shows the administration of medicine according to the dates and the results obtained. First, the medicine administered was Saptasara Kashaya, Avipatti Churna, and Himosid syrup. The patient had symptoms like retrosternal pain, burning sensation, nausea, vomiting, and the patient was also unable to take the normal diet because of the symptoms. And the result obtained was the patient was able to take normal food without aggravation of the symptoms. Again, the medicine was continued along with Dhanvantaram Guliga. Patient finds symptomatic relief. Later in 29/8/2017, the medicine Yashtimaduk Shirapaga was also added. Patient got significant relief in the symptoms and also noted weight gain. Again, the medicine was continued. Later, an endoscopy was done in March of 2018, which showed significant improvement, and the treatment was ended by using a prophylactic medicine. The medicine used here was Dadimadigrada, and follow-up was also done. Patient showed no other complaints. This shows the picture of endoscopy reports, which was taken before starting of the treatment and after treatment. The report after the treatment showed significant improvement in the symptoms. Treatment protocol followed was the Saptasaram Kashayam was used in order to tackle the symptoms like Ruja, Afrit, Kukshi, and Prishta. And Dhanvantaram Guliga was given as Vadanulomana and Shula Prashamana. Himosid syrup helps in Pitta Shamana. Avipatti Churna, again Pitta Shodhana. Hingwajadi Gudiga, Vadanulomana. Yashtimaduk Shirapaga, which was used as Pranapaha, as well as Rasayana. The glycyrrhizin content, which is present in Yashtimadhu, it's a saponin-like compound. It regulates certain pro-inflammatory mediators, protecting from reactive oxygen species, which is inducing the damage, modulates certain enzymes involved in inflammation and oxidative stress, suppresses the growth of susceptible tumor cells. Moving on to the conclusion. Combined effect of medicine resulted in clear and stable clinical improvement. Weight gain indicated better tolerance of the food and relieved symptoms. The intervention prevented further aggravation of symptoms and progression of the disease into pre-malignant condition. Thank you.
Thank you, Dr. Aparna. Now I invite Dr. Bhuvaneshwari Patil. I invite Dr. Bhuvaneshwari.
Hello, good evening.
Good
Am
evening,
I audible, ma'am?
Yes, doctor.
Yes, doctor, audible, doctor.
Okay, myself, Dr. Bhuvaneshwari, Associate Professor, Department of Vrutta from BLS AVS Ayurveda Mahavidyalaya, Jaipur. Role of yoga in the management of diabetes mellitus type 2 was my topic. Introduction. Yoga is an ancient Indian science which focuses on bringing the harmony between the mind and the body, which helps to attain higher level of physical, mental, and the spiritual balance. Yogic lifestyle and yogic practices help humans to strengthen themselves and as well as develop the positive health. Modern lifestyle requiring more speed and accuracy in today's world of the competition, diet pattern, lifestyle, and behavioral pattern of people have changed. Late working hours, deadlines of work, and stress have become a part and parcel of the daily life. Due to this, people won't have time for the exercise and yoga, hence end up in various lifestyle disorders like diabetes mellitus, hypertension, obesity, etc. Diabetes mellitus is a group of metabolic disorders characterized by the chronic hyperglycemia due to the relative insulin deficiency or the resistant or the both. WHO determined diabetes is the third most deadly disease in the world. As per the current prevalence rate of the diabetes ranges between the 10.9 to 14.2 in urban areas. The estimated number of the diabetes patients in the 20 to 79 age group is around 74.2 million in 2021 and is likely to increase to 124.8 million in the year of 2045, said Manushka Mandavaya, Union Minister of Health and Family Welfare to the Lok Sabha 6 December 2021. Statistics says every 1 in 4 people is diabetic. Diabetes mellitus type 2. It is mainly caused by the lifestyle and the stress. Diabetes can be effectively treated with the yoga. Ashtanga yoga are nothing but the yama, niyama, asana, pranayama, pratyahara, dharana, dana, and the samadhi. So practice of asana, pranayama, and the dana can be the beneficial for the management of the diabetes. Mode of action of the yoga in the management of diabetes. As well, stress is the one of the major cause for the diabetes. In stressful condition, body secretes the glucagon. Glucagon increases blood glucose level. Practices of asana, pranayama, and dana reduces stress, and hence glucagon reduces, and hence it will be helpful for to improve the insulin level in the insulin level. Mode of action of the asana. When you come for the each asana pranayama, the first will be the mode of action of asana. Asanas are nothing but so those are some of the exercises. So mainly the practice of asana will be reduce the pressure on the abdomen area. That will be further stimulates the pancreas. That will help to circulate the blood to the pancreas and improve its ability to increase the insulin production level. Asanas normalize glucose level by gently compressing and as well as stimulating the endocrine and exocrine gland and as well as the internal organs. In asana, mainly because of the various twists and the stretches and as well as the strains in the body, it will be leads to the organs get stretched and subjected to the strain. So this increases the blood supply and as well as the oxygen supply to the organ, and that will be efficiency. That will help to get the efficient and functioning of the organs. Stretching various glands results in the increased efficiency of the endocrine system, and also it will help to muscular movement and as well as brings down the blood sugar level down, increases, then maintains the normal blood glucose levels. So asanas reduce the weight and slows. It also helps to slow downing of the fat accumulation in the process. Asanas reduces the risk of the cardiovascular diseases also. Next comes the mode of the action of the pranayama. Pranayama is the one of the 4 limb of the Ashtanga yoga. Pranayama refers to the breathing exercises which are clear and that will be mainly affect on the physical, emotional obstacles in our body to free the breathe and as well as to have the flow of the prana, that is the life energy. Specific breathing exercise help in pancreas for the stimulation. Nadi Shodhana pranayama that will help for the calming effect on the calming effect, especially on the nervous system. By reduce, it will be further helps to reduce the stress level. Brahmari pranayama is also excellent practice for the reduce the stress level. Next is the mode of action of the dhyana. Dhyana is the 7th limb of the Ashtanga yoga. Dhyana, it is nothing but the art of harmonizing the spiritual, mental, and as well as the physical energy through the connection with the soul. A few minutes of regular meditation practice acts as an excellent stress booster for mind and as well as the body. Meditation by chanting Omkara mantra and concentrate on breathe have a positive effect on the sugar levels. Asanas which prevents and control the diabetes. So here we have mentioned some of particular asanas: Surya Namaskara, Paschimottanasana, Ardha Matsyendrasana, Halasana, Shalabhasana, Bhujangasana, Dhanurasana, and the Supta Vajrasana. Surya Namaskara. Surya Namaskara is it will have the 12 steps. Mainly, it will be helps to improve the blood circulation to all the parts of the body and stimulate the pancreas and improve the digestion and appetite and effective even it is effective for the weight loss also. Paschimottanasana. It provides adequate massage to the pancreas and forces the endocrine gland to release the insulin, thus ensures in the prevention and management of the diabetes. Halasana. It will help to improve the digestion and appetite, and it is also effective in the weight loss and beneficial for diabetic people. Those people should do this regularly. It will help to strengthen the abdominal muscles also. Shalabhasana. It improves the functions of the liver, pancreas, and abdominal organs and stimulates the appetite and as well as alleviates the disease of the lower bowel syndromes. Next is the Bhujangasana. It increases the functions of the liver, kidney, pancreas, and the gallbladder, and it is also cures the back pain and the spondylitis, etc. Next comes the Dhanurasana. It helps to improve the pancreas function and also helps in reducing the fat around the belly area. Supta Vajrasana. Supta Vajrasana massages the abdominal organs and improves the digestion process and also helps in treating the pancreatic disorders. Discussion and the conclusion. Discussion. Asanas like Surya Namaskara, Paschimottanasana, this will be how the mainly makes the pressure on the abdomen, which further helps for the stimulation of the pancreas and improves its ability for the insulin production, and hence normalize the glucose level by gently compressing and as well as stimulating the endocrine and the exocrine glands and also internal organs. When it comes to the conclusion, regular practice of yoga helps to reduce the sugar level in the blood, reduces the severity of the symptoms, and also prevents the complications. By adopting yoga for diabetes along with other lifestyle changes, the patient can find relief and enjoy a new level of the health and the well-being. Thank you.
Thank you, doctor.
Thank you, doctor, for this wonderful presentation.
Thank you for giving the opportunity. Thank you.
Next, I invite Dr. Piyush Manik Pawar for the paper presentation. Dr. Piyush, are you there?
Yes, sir. Yes, sir. Yes, sir. Yes, sir. Good evening, sir.
Okay,
I'm
doctor.
sharing.
Good evening, doctor. Please share the screen, doctor.
Good. Yes, yes. Just a second.
Hello, Dr. Piyush.
Yes, sir. Sorry, sir. There is some issues in my PC. Just a second.
For you, doctor. I will
Yes,
share
yes,
for
sir.
you,
Please.
doctor. Please chat
Yes,
the
sir. Yes, sir.
session.
Please. Yes, sir. Yes, sir. Please. Good evening, sir. Good evening, ma'am. I'm Dr. Piyush Pawar from PG Scholar from Department of Kaya Chikitsa, PDS College of Ayurveda and Research Center, Nigri, guided by Dr. Rupali Khobragade, ma'am, Professor Kaya Chikitsa Department, PDS College of Ayurveda and Research Center, Nigri. Sir, I'm discussing a case for Kati Basti and Ayurvedic management in Dhatuk Shaijannya Katigatvat. I'm going introduction. Katigatvat is a type of Sandhigatvat explained by Acharyas in different Sahitas. Katigatvat is explained in two types. One is a Dhatukshayajanya and second is a Margavrojanya. Margavrojanya means there is obstruction in normal Vadgati which causes pain and pain in stiffness in joints, which is mainly due to Strotojusti. Second is a Dhatukshayajanya which is affected due to degenerative changes in patients due to age-related or misuse of joint. So the degenerative type of cases for treating them, Katibasti has a significant role along with medicine. Katibasti is a process in which the medicated oil is kept on lumbar region, mostly Katigatvat is of lumbar spondylitis of vertebral column for some time limit with thinking of its local absorption. Sir, next slide, please. Clinical feature of Katigatvat Dhatukshayajanya. It includes Katishul, that is backache, Chankraman Kashtata, that is discomfort and pain while walking, Asan Kashtata, discomfort and pain while sitting, Ubhaypad Chimchimayan, tingling sensation in bipedal, and Ubhaypad Supti, bipedal numbness. So next slide, please. Case report: a 60-year female patient who is a housewife, no known case of DM and hypertension, suffering from Katishul, Katitu Pada Sanchari Vedana, Chankraman Kashtata, Ubhay Pada Chimchiman. Patient advised operative for above complaints because of patient's MRI shows disc bulge and some kind of reports that is sacralization of sacral vertebra, which is shown in next slide. So for this patient advised operative, but patient not willing for operative, so patient came for Ayurvedic management. Patient so advised Snehan Sweden. The MRI slide shows the disc bulge as L3, L4, L4, L5 region, creating pressure on cord and mild degenerative changes in the cord. So also shows the fusion of sacral bone, that is sacralization of the vertebra. Next slide, please. Material and method of Katibasti. In this case, we used two oils. That is, one is Kotam Chukkadi Tel and second is Kshir Bala oil. In this, patient was asked to sleep on prone position. The dam of Doug, which is wheat flour or maida, is kept on a region where the pain is more or the degeneration is more. In this case, we kept it on L3, L4 vertebra. Then the both above medicated oils made warm enough, and then we pour it into the duff. After 5-6 minutes, we keeping it in. We after change the oil and again pour the warm oil in that procedure. The total procedure we take for 15 to 20 minutes. The same procedure. Hello, sir, am I audible?
Yes,
Hello?
doctor,
Audible.
please
Please
continue.
continue, doctor.
Yes, sir. Yes. So before treatment, the Katishula was patient of 3+, Katitupada Sanchari Vedana was 2+, Chankraman Kashtata 3+, and Ubhaypada Chimchaman, that is tingling of 2+. After totally 7 days of treatment, we got the Katishul reduced to 1+, Katitupada Sanchari Vedana to 1+, Chankraman Kashtata, patient has no Chankraman Kashtata, and Ubhaypada Chimchaman also reduced after the treatment of result. After 3 days of treatment, there was significant relief from complaints at almost 40-50%. After 7 days of procedure, it was observed that patient felt relief from above mentioned complaints. And after a few more days with additional help from oral medicine, there was significant relief from Dhatukshejanya. So next slide, please. Discussion. Here we're discussing the oils we used in it. The Kottam Chukadi tail is a Vata Shamak and also works as missile relaxant. It works as Avrodhanashak due to its properties. Whereas the Kshirabala oil is a Vata Shamak, but it's a Balya and it's reduced on the degenerative and it's help in the degenerative changes. Koshna tail, which helps in effective penetration of drug and also works as a Swedana material. Summary and conclusion. Katibasti very effective treatment for Dhatukshejanya Katigatvat, that is lumbar spondylosis. It mainly due to direct application of drugs locally on target organ. So the case study of Katibasti of Kottam Chukaditel plus Shirabalatel showed good result in the management of Dhatukshejanya Katigatvat. Thank you, sir. Thank you, sir. Thank you, ma'am.
Thank you, doctor.
Thank you.
Next, we invite Dr. Busra Tasneem.
Yes, ma'am. Yes, ma'am is a 2008 film directed by Patil Reed, starring Zoe Deschanel, Jim Carrey, and Heidi Hirschbaum.
Dr. Busra.
Yes, ma'am. I'm sharing the screen.
Share the screen.
Hello, Dr. Busra. Please share
Yes,
the
sir.
screen, doctor.
Okay, doctor. Is it visible?
No, doctor.
Is it visible, doctor?
No, doctor, your screen is not visible, doctor. Doctor, you have any problem with screen sharing? I will share for you, doctor.
Okay, doctor. Can you please share my screen?
Okay, doctor, please start the session.
Good evening, all. My topic is Rasavaha Srodhas. Myself, Dr. Bushra Tasneem, finally a PG scholar, Department of Kriya Sharira, Government Ayurveda College, Kannur. Introduction. The formation and circulation of the dosha, dhatu, and mala takes place through srodhas. Srodhas are the channels or the pores in the body which provides nourishment to the whole body and responsible for some particular function with respect to the body part. The major srodhas are 13 as per Charaka Samhita and 11 pairs of srodhas as per Sushra Samhita. The srodhas not only perform various functions, but disturbance in the srodhas may also impact some pathological manifestation. Therefore, it is very essential to understand the physiological concept of srodhas. When there is excess, deficiency, or blockage in these channels, the diseases can take place. Then the Rasavaha Srodho Moolam. According to Charaka, the Rasavahanam Srodasam Hridayam Moolam Dashacha Damanya. According to Sushruta, Rasavahe Dve Tayor Moolam Hridayam Rasavahinesha Damani. Here the Moola is the heart and the great vessels, and the Marga is the venous and the lymphatic system, and Mukha is the arteriole and the venous junction in the capillaries. So, next. So, according to Ayurveda, the Rasavaha Srodho Moolam is Hridayam and the Dhamanis, and this can be substantiated with that of the lymphatic system and its relationship with that of the cardiovascular system. Here, in the blood that is flowing through the blood capillaries will enter the interstitial space as the interstitial fluid, and from the interstitial space, it then enters into the lymphatic capillaries as the lymph, and then into the lymphatic vessels, the lymphatic ducts, and finally it enters into the vein as the venous blood. And from this, it is proven that the Rasavaha Srodho Moolam is Hridaya. Sir, next slide. Then role of Vyanavayu and Samanavayu in Rasa Samvahana. According to Charaka, Vyanena Rasadadurhi Vikshebojita Karmana, Yugabat Sarvado Ajastram Dehe Vikshipyade Sada. And according to Sharingdara, Rasastu Hridayam Yadi Samana Marudirida. That is, the Vyanavayu is responsible for the circulation of the Rasadadu from Hridaya, and thus it circulates all over the body. And according to Sharingdara, the Samanavayu is responsible for bringing the Rasadadu to Hridaya. Sir, next slide. Then the lymphatic system, it consists of the lymphatic vessels and the structures and the organs containing the lymphatic tissue and the red bone marrow. The functions includes circulating body fluids, that drains excess interstitial fluid and transport the dietary lipids. Next slide. The Rasavaha Srodho Dushti Nidanam. According to Charaka, Guru Shida Madisnigda Madimatra Samashnadam, Rasavahini Dushyanti Chindyanam cha Adi Chindanat. Here Guru Ahara is the excessive intake of the heavy diet like cheese, fast food, Chinese, bakery products, etc. Shida Ahara is the excessive intake of cold food or the products. Adi Snigda is eating too oily or unctuous food, and it will increases the blood viscosity, creating Srodho-rodha. Samashana is a taking wholesome and unwholesome diet together. Adimatra Ashana is the excess food, and Mansika Hedu is the Chinda, that is, it leads to a Rasavaha Srodho Dushti causing cardiac diseases, hypertension, and it ultimately hampers the mental and the physical health. Then Rasavaha Srodho Dushti Lakshana. Ashraddasha Ariji Asya Virasya Marasat Nada, Hrillaso Gauravam, Tantra Sangamardo Jarastama, Pandutum, Srodasam Roda, Clibium Sada Krishangada, Nashu Atnere Dakalam, Valaya Palidanicha, Risa Pradoshija. So it includes
No, doctor. No, Dr. Visha, can you hear me? Hello, Dr. Visha, can you hear me? Next, I invite Dr. Mayuri P for the paper presentation.
Yes, sir. Am I audible?
Audible, doctor.
Yes, sir.
Please share
Good
the screen,
evening, sir
doctor.
and madam.
Hello.
Yes, sir. Yes, sir. I'm sharing my screen. Good evening, respected sir and madam. I am Dr. Madhuri Prashantu Vagmare from CSMS Ayurved College, Aurangabad, Maharashtra. With the blessing of Dhanvantari, I started my presentation. It is on Karsha relation with Manas Bhava with special reference to Krodha Shoka Bhaya. Yes, introduction. Ayurveda deals with the study of human being through physical, psychological, and spiritual aspect. Sharira is the important element of every human being. According to Acharya Charak, there are 8 types of undesirable physical constitution called Ashtonindit Purush. In the context of the body, structure, and appearance, the following 8 types of person are considered undesirable. That is Ashtonindit Purush, and they are too tall, too short, too hairy, hairless, too dark, too light complexion, too obese, and too lean. A person with a balanced proportion of muscle and compactness of the body and firmness in sense organ is not overcome by the onslaught of disorder. Such a people can tolerate hunger, thirst, heat of sun, cold, and physical exercise. Their digestion, assimilation of food, and muscle metabolism is in the state of equilibrium. Acharya Charaka and Bhagbata has explained the Lakshana of Karsha, Krusha person buttocks, abdomen, and neck are emaciated. There is a vascular network in the skin. The joints are predominantly seen, and the man appears to have bone and skin only. The etiology of Krusha persons are indulgence in the intake of dry, untuctus diet and drinks, fasting, intake of food in inadequate quantity, overuse of therapeutic purificatory measures, grief, suppression of natural urges, inadequate sleep or sleep deprivation, dry powder massage, indulgence in baths, hereditary old age, continued illness, and anger make a person too lean. Objective is to role of Manas Bhava, Krodha Shoka Bhaya has Etu in Karsha Vedi, and other objective is to study Karsha in detail and Manas Bhava in detail. Operational definition is Karsha means lean, Manas Bhava means psychic factors, Krodha means anger, Shoka means grief, Bhaya means fret or fear. Lakshana of Karsha, Shushka Spika Udaragrivo, Dhamni Jala Santataha, Tvagasti Shesho Atikrushaha, Sthula Parva Naromataha. It is said in Charak Sutrasthan 21:15. Spika Shushkata, Udar Shushkata, Griva Shushkata. Second is Dhamni Jal Santat. Third is Tvagasti Shesh, and fourth is Sthula Parva. Dosha of Krusha person. Vyamam Atisohityam, Kshut Pipasam Aushadham, Krushona Sahate, Tadvat Ati Shitoshna Maithuna. It is said in Charak Sutrasthan 21:13 Shlok. Number first, it cannot stand physical exercise. Second is cannot tolerate excessive intake of food. Third is cannot stand delayed hunger and thirst. Fourth is cannot stand disease and drug intake. And fourth is cannot stand excessive heat or cold. Manas Bhava is Krodh means anger, Shoka means grief, and Bhaya means fear. Questionnaire for Krusha. We can assess the patient with this question. First question we can ask is Spik Udar Griva Shushkata present? Second, Dhamni Jal Santat, Tvagasti Shesh present or Sthura Parva present? Questionnaire for dosha of Krusha person, physical exercise. Do you practice exercise? Does you stand for physical exercise? Do you perform excessive exercise or do you feel exhausted during exercise? Intake of food. For this questionnaire, we can ask, do you take excessive food? Does you feel fullness of abdomen after taking excessive food? Number third, do you feel restlessness after taking excessive food? For hunger, we can ask questionnaire, do you tolerate hunger? Does you feel uneasy while hungry? Questionnaire for thirst, do you tolerate thirst? Does you feel uneasy while thirsty? Drugs, the questionnaire for disease or drugs. When you are sick, can you tolerate that phase? Do you tolerate intake of medicines? Questionnaire for excessive cold and heat. Do you tolerate environmental excessive cold? Do you tolerate environmental excessive heat? Do you take hot drinks? Do you take cold drinks? Assessment for growth. For this is the assessment for growth. This is 20 assessment. First is get angry with little or no provocation. Second is really bad temper. have hardness to let go that make you angry, then angry urge to beat someone, then angry urge to break or tear things, get impatient while patient don't understand, people don't understand, loss of temper at least once a week, embarrass family, friends when you anger burst, get impatient when people in front of you drive exactly speed limit, get angry if neighbors inconsiderable, find frequently annoyed with certain friends or family, get angry when people do things that they are not supposed to do, feel that certain people always rub you the wrong way, feel upright or tense, yell or curse, get angry that you will going to explode with rage, get easily frustrated when machine equipment do not work properly, remembering the people or situation make you angry for a long time, or tolerate incompetent which make you angry, think that people try to take advantages of you. Assessment for Shoka. For this assessment, there are 4 assessments: feeling of sorrowness, feeling of inferiority and sorrow at occasion, having inferiority complexes and greedy, wiping and feeling inferior. Assessment for Bhaya, there are 16 assessments while cleaning the house, getting dressed or undressed, preparing simple meals, taking bath or shower, going to the shop, going in or out of chair, going up and down stairs, walking around in the neighborhood, reaching for something above your head or on ground, going to answer the telephone before it stopped ringing, walking on slippery surface, visiting friends or relatives, walking in crowded places, walking on uneven places, walking up and down on slope, going out to the social events. For this, we can assess objective criteria: neck, waist, and hip circumference. Neck circumference normal is 35.5 centimeter to 40.6 centimeter. For Karsha, 32 centimeter to 35 centimeter or below normal. Base circumference below normal for normal men and women. For men, 91 to 98 centimeter. For women, 85 to 88 centimeter. For Karsha, below 90.5, that is 83 to 90 centimeter, and for women below 84.5 centimeter. Hip circumference below normal. For normal, male 98 to 105 centimeter. For women 103 to 108 centimeter. For Karsha, male below 99.5 centimeter, and for women below 102.5 centimeter. For discussion, Karsha is seen in 8 to 10% in general population. In today's life, physical constitution is adversely affected due to improper diet, junk food, improper sleep, and suppression of natural urges, etc. will develop Karsha, which is seen in general appearances. A person's general appearance is also affected by Manas Bhava, means psychic factors like Krodha, Shoka, Bhaya. These Manas Bhava are regulated by body itself up to its physiological limit, which are called Prakritik Manas Bhava. When these factors exceed physiological limit by a supportive factors termed as Mansik Vikar, means psychic disorders, they can affect ability to correlate with others and functions of daily routine. Conclusion: in society, general appearance plays important role to impress others, to convince others, and for healthy and happy lifestyle. Manas Bhava is responsible for significant improvement of daily life. These exceed physiological limit of Mansik Vikara, Karsha develop. Nidan Parivarjan and Achintya are most important aspect of Ayurvedic Chikitsa. These are reference, and thank you.
Thank you, doctor.
Thank you, ma'am.
Now I invite Dr. Bushra Tasneem. Dr. Bushra.
Yes, ma'am. Ma'am, can you please share my screen?
Just a moment.
Please continue the session, doctor.
Yes, sir, can I start?
No, doctor, please continue the session, doctor. Please start.
Thank you, sir. Then Ashraddha, it is a disinclination for any type of food or loss of desire for food. Aruji, even though the person is having the desire for food, he will not feel the taste once it is ingested. Asya Vairasya, it is an altered taste in the mouth. Sir, next slide. Arasatnada, loss of sensation of taste in the mouth. Trillasa is the excessive salivation or nauseating sensation. Gaurava is the subjective feeling of heaviness. Tantra, it is one among the Kaphaja Nanatmaja Vyadis, and it is because of the predominance of Vada, Kapha, and Tamoguna. Angamarda is a painful sensation all over the body. Jwara, due to the exposure to Mityahara Vihara, the vitiated doshas in the Amashaya displaces Agni from the Koshta and spread all over the body along with the Rasadadu. Tama is one among the Vadaja Nanatmaja Vigaras, and it is a sudden feeling of darkness in front of the eyes. Pandu is a recta and the pida discoloration of the skin. Srodoroda is the obstruction to the Dadu Parinama Krama in the Srodhas. Clybia is the impotence in both the males and females, and the pathogenesis of clybia involves resakshaya or shoshagenya. Sada is the weakness in the particular body parts. Krishangada is the emaciation of the body parts. Agni Nasha is the total absence of Agni. Ayada Kala Valaya is the wrinkles and the change of skin texture which occurs as a result of loss of elasticity of the skin. Ayada Kala Palitya is the Kesha Paga because of the excessive exposure to Krodha, Shoga, and Shrama. According to Sushruta, the Sushruta has added 3 more Lakshanas, that is Avipaga, it is the indigestion of the food resulting from Agnimandya. Tripti is the feeling of satiety, and Hridroga, here the Rasadadu being vitiated by the doshas vitiates Hridaya and thus causing Hridroga, as it is the main site of Rasadadu. So here the Rasavaha Srodho Dushti Lakshanas, it can be substantiated according to the modern concepts also. And according to some studies, it is seen that the ingestion of the food with a high glycemic index, that is a high glycemic high glycemic index food includes the Guru Shida, Adisnigdha, and Adimatra Ahara, and it will accelerate the signs of aging as it promotes the cross-linking of the collagen fibers, and the changes in the collagen and the elastic fibers of the skin results in sagging and loss of elasticity. Then heart disease or the Hridroga, the increased plasma viscosity is an easily accessible marker of the early atherosclerosis, and it is positively associated with the incidence of the chronic heart disease in the population-based study of the middle-aged men. Then anemia, among the junk food consumers, 69.1% were anemic and their HB levels were lower than that of the non-consumers of the junk food. Then, according to one study, the study is that the changes in the plasma protein expression indicative of early diet-induced metabolic disease in the male pigs. And in this study, the pigs were given cafeteria diet, that is unhealthy and high in saturated fat diet, and Mediterranean diet, that is considered as healthy and high in unsaturated fats. Here, the cafeteria diet shows increased plasma level of the proteins, and it is related to the LDL or bad cholesterol, immune processes decreases, and the blood clotting increases. And the Mediterranean diet shows it is related to the increased HDL, immune processes, and glycolysis. And from this, it is the next slide. Next, it is physiological importance of Rasavaha Srodhas. It served as a place of transformation of Ahar Rasa to Rasadadu. It offers a pathway for transporting the Rasadadu in the body, and the proper functioning of these Srodhas offers excellence of the Tvak characterized by Snigdha, Shlakshana, Mridu, Prasanna, Sukshma, Gambhira, and Sumara appearance. The physiological normalcy of Rasavaha Srodhas offers happiness, power, enjoyment, intellect, and longevity. The assimilation and digestion of the Ahara takes place with the help of biochemical process of the Rasa, which transport through Rasavaha Srodhas. Rasavaha Srodho Dushti should be treated to avoid the Rasa Dushti and ultimately further Dhatu Dushti and Srodho Dushti. And Rasavaha Srodho Vidya Lakshanam, Tatra Vidyasya Shosha, Pranavaha Vidyavacha, Maranam, Talinganisha. So according to Sushruta, its Lakshanas are Shosha, Pranavaha Vidya Lakshanam, and Maranam. And this can be correlated with that of the signs of dehydration and hypoxia. Dehydration symptoms include irritability, dizziness, fatigue, delirium, and death. And hypoxia symptoms include mental and muscle fatigue, nausea, dizziness, euphoria, shouting, crying, coma, and death. In treatment of Rasavaha Srodho Dushti, Rasajanam Vigaranam Sarvam Lankanam Aushadam. So the Langana, the 10 types of Langana are described in Charaga as the treatment of Rasavaha Srodho Dushti. Conclusion. Rasavaha Srodhas perform vital functioning of the body related to the circulatory process, and physiological disturbance to their functioning may lead some pathological manifestation. And if these Srodhas not work properly, then Dhatu nourishment not takes place and may result in severe illness. The Rasa Dhatu Agni is present in Srodhas. Its important function is the formation of Rasa Dhatu. The Rasa Dhatu is firstly formed Dhatu in all the Dhatus, which carry the nutrition to all the Dhatus. If there is any Dushti of Rasavaha Srodhas, it can lead to Vriddhi or Kshaya in the Rasa Dhatu, and which causes the improper functioning of other Dhatus. So these are the references. Thank you.
Thank you, doctor. Next, I invite Dr. Sai Om Prakash. I invite Dr. Sai Om Prakash.
Next, I invite Dr. Vishal Vijay for the paper presentation. Dr. Vishal, are you there?
Hello, sir. Good evening. Am I audible, sir?
Audible, doctor. Please share the screen.
So can you please share my slide?
Okay, doctor, I will share for you. Dr. Vishal, please start the session, doctor.
Hello. Sir, good evening. Sir. I'm Dr. Vishal Vijay, third year MD student, Chatushtaya department from PMT Ayurveda College, Shivgaon. I'm here to represent the topic of comparative clinical study of Nimbadi Gugurvati and Patyadikvat in Vata Shirashul with respect to tension headache. Next slide, please, sir. Ayurveda is not only a system of medicine, rather than it's a way of life. In Samhitas, are primarily meant for the enhancement of Dhi Smriti, like intellectual functions. If we can successfully enhance this function, it will help to combat against the various causes of headache. Such as the most common causes are the irregular food habits, lack of proper sleep, and less time for relaxation. The main being part of our life, which enhances the incidences of many diseases, mainly having the tension headache. Is the most of the common disorders which can be compared with Vata Shirashul as described in the Ayurvedic text. Nearly 80% of population have the tension headache, in which, as estimated, 1 year prevalence of 86% in men and 63% in women. Objectives are to evaluate the efficacy of Patyadikvat in management of Vata Shirashul and the efficacy of Nimbadi Gugurvati in the management of Vata Shirashul. To compare the efficacy of Patyadikvat and Nimbadi Vata Gugurvati, to study in detail about the Vata Shirashul according to the Ayurvedic classics and tension headache according to the modern texts. Next slide, please. Aim of the study is planned to evaluate the therapeutic effect of the Nimbadi Gugurvati and Patyadikvat in the patient suffering from Vata Shirashul. We have made some inclusion criteria. According to that, we are taking the patients. First is headache lasting from 30 minutes to 7 days. Headache which is pressing, tightening, or stretching in nature. Patients who are having the Shirorujam, Bhrumadhya Eva, Lalata Pradesha, and Shirogurutvam, stressful situations causing tension type headache. Patient who are having primary headache and having the patient of both male and female between the age of 20 to 50 years. Exclusion are the patient below 20 years and more than 50 years having the headache like migraine, cluster headache, pregnancy lactating mothers associated with the symptomatic systemic disorder like hypertension, diabetic mellitus, and patient with ENT infections, any pathology involving eye or eye disorder like glaucoma, secondary headache arising due to meningitis, tumor, cervical spondylosis. These are the exclusion criteria for the topic. These are the contents of the Patyadikvata, Bibhidaka, Amlaki, Piratatikta, Darvi, Nimba, Guduchi, Patya, and Nimbadi Gugurvati, Nimbatvaka, Haritaki, Bibhidaki, Amlaki, Vasa, Gugur, and Patola. The doses are given. The Patyadikvat should be 48 ml given in divided doses, 2 divided doses. Duration for it should be given for 30 months. Follow-up we have taken for 30 days. Duration is for 30 days. Follow-up we have taken after 30 days. Anupana is with the medicine should be taken with Ushna Jala. The route is oral, and Aushad Sevankar is Prabhakar. For Nimbadi Gugurvati, the dosage is 500 mg twice a day after meal. Duration for 30 days. Follow-up you have taken after 30 days. Anupana is with the Ushna Jala. Route is oral, and Aushad Sevankar is after food. Assessment criteria, we have taken the subjective parameter and objective. Subjective are the Shirorujam, Shankanishula, Bhrumadhya Evam Lalata Pradesha, and Shirogurutvam. And objective parameters are visual analog scale, that is VAS, and headache disability index. Observation in total, we have taken the 40 patients of Vatashirosul. In all these 40 patients registered, completed the stipulated schedule of the study, and the patients were selected irrespective of age, sex, and caste. The observation and the results, as well as the statistical analysis and related in the following headings: descriptive statistical analysis of the patients. Next slide. Statistical analytics. That is, the total 40 patients were registered in the study. Out of that, 40 patients were studied in the project. The 20 patients we have taken in the group A and 20 patients in the group B. The statistical results of the Nimbadi-Gugulwati in the group A, and group B, we have taken the Patil before and after treatment. Distribution according to the sex-wise, out of 40 patients in group A and group B, 34 patients were male, that is 85% of total, and 6 patients were female, that is 15%. Next one. On the distribution on the age, out of 40 patients in group A and group B, the maximum in the group were in the age of 40 to 50 years of age. They were almost 55%, and they were in group wide discussion, they were almost 60 and 50% respectively in group A and B. Based on the occupation, out of the total 40 patients in the group A and group B, maximum patients were found in the business. They were almost 13, about 32.50% criteria. And in group wise discussion, in the group A, they were 25%, and group B, they were 40%. On the religion wise, out of the total 40 patients in group A and group B, the maximum patients were of the Hindu religion, that is 85%. Group wise distribution, in group A, they were 70% of the Hindus, and group B, they were total 80%, 100% of Hindus. Distribution on the patient based on education. In group A, maximum patients were educated, education were graduate, that is 13 patients were graduate, almost 65%. And in the group B, the maximum patients education were graduate, that is 15, that is 75%. Based on the region, out of 40% in the group A and the group B, maximum patient the region were urban, 55%. Group wise division we have taken. In group A, there were almost 55%, and group B, there were 55%. Distribution of the patient based on the Western habits. Out of the total 40 patients in the group A and group B, maximum patient Western was not there. Group wise distribution, in group A, there were 51%, in group B, there were 25%. Distribution of the patients based on the occupation. Occupation wise, out of 40 patients in the group A and B, maximum patients were found business, there were 13, and in group A, there were 25%, and group B, there were 40%. Effect of Nimbadi group A and Pathetic group B. The effect on chirurgism before treatment in group A, it was 2.5. After treatment, it was 1.15. And in group B, before treatment, it was 2.85, and after treatment, it was 1.75. That is the total percentage criteria of improvement. In group A was 54%, and group B improvement criteria was 38%, 38.6%. So the improvement criteria of chirurgism in Nimbadi-Gugulwati in chirurgism, it was good in Nimbadi-Gugulwati. Chirurgism. Next slide, please. Effect on Shankha Nishula. Group A mean score, which was 1.40 before treatment, was reduced to 0.25 after treatment, with 82.14% of improvement, and there is a statistically significant. And group B mean score, which was 1.35 before treatment, which was reduced to 0.45 after treatment, with 66.67% improvement, and there is a statistically significant. Effect of Bhrumadhya evam Lalata Pradesha. Group A mean score, which was 1.30 before treatment, was reduced to 0.55 after treatment, with the 57.69% of improvement, and that is the clinical significant. And group B mean score, which was 1.70 before treatment, which was reduced to 0.55 after treatment, with 67.65% improvement, that is clinically statistically significant. Effect on serotonin, group A mean score which was 1.15 before treatment was reduced to 0.45 after treatment with 60.87% improvement, and there is a satisfactory. Group B mean score which was 0.85 before treatment was reduced to 0.00 after treatment with 98% of improvement. That is clinically statistically significant. Effect of headache disability index, group A mean score which was 2.20 before treatment was reduced to 1.25 after treatment with 43.18% of improvement, and there is a statistical significance. And group B mean score which was 2.15 before treatment was reduced to 0.45 after treatment with 79.07% improvement, and there is a statistical significance.
Dr. Vishal, you are
Yes,
exceeding the time limit. Please speed up.
Yes. Group A, which was score of visual analog score, which is 2.015 before treatment was reduced to 1.20, and with the treatment of 41.46% improvement. Overall effect which was seen in the group A, that is no, we have seen the moderate improvement. Okay, next slide. Effect of Patil in group B, we have seen the moderate improvement and as well as the marked improvement. That is 100% we have seen. In comparative clinical analysis of overall effect of treatment in group A and group B was statistically by unpaired test that they show that the treatment is statistically in group B. Discussion, we have seen in total 40 patients of tension headache, which was studied, 55% were belonging to the all that I have described before, sir. Next slide, sir, please. Next slide, sir. Conclusion, the overall effect of pneumatic V shows the moderate improvement 50% and mild improvement in 25% of patients. The overall effect of Patil shows moderate improvement 75% and marked improvement too. Comparison, both drugs show the good improvement in Vata Shirashil, but Patil gives better improvement in Shankas's Dushi, Bhumadhyam Eva Lalata Pradesha, and also give better improvement in tension headache, disability, and visual analog score. The above results simplify the Patil was better on Vata Shirashil. It was more effective on chip complaints. Thank you, sir. Thank you, ma'am.
Thank you, doctor. So next we invite Dr. Amarjit Angush Chavan.
Yes, ma'am. Yes, I am here. Yes, please, ma'am, share my screen. I am not able to share screen. Please, ma'am, share my screen. I am not able to.
Just a second.
Ocular pharmacology.
Dr. Amjit.
Yes, sir.
Please start the session, doctor.
Ocular pharmacology.
Please start the session.
Yes. Good evening, everyone. Myself, Dr. Amarjit Ankush Chavan. I am second year PG scholar from Kolhapur, Kodoli College. Next slide, please. My topic is ocular pharmacotherapies, which is by 4 methods. First is topical instillation, second is peripulvar injection, third is intraocular injections, and last one is systemic administration. Next slide. Drugs given by mouth or injection, but if has obvious limitations because the blood-aqueous barrier and blood retinal barrier. Drugs enter in the eye in proportion to their lipid solubility and smaller molecule size. Examples, sulfonides has much better penetration than the penicillins. Blood-aqueous barrier is formed by non-pigmented layer of ciliary epithelium and by endothelium of the iris vessels. And last point is blood retinal barrier is located in retinal pigments, epithelium and endothelium of the retinal blood vessels. Next slide. Local route is first one is aqueous or viscous solution as a drop ointments. Second one is drug integrated contact lenses. Third one is membrane release system occurs. Fourth one is subconjunctival. Fifth one is retrobulbar injections. Topically installed medication largely penetrate intraocularly through the cornea. Drug should be soluble in both water and fats. and agent that reduces surface tension, increased corneal wetting. And benzyl polyum chloride is used for preservative. Next slide. There are many forms: eye drops, eye ointments, gels, and aquarest. Eye drops are the simplest and most convenient method of topical application for nowadays. Eye ointments, these forms of application increase the bioavailability. That's why they are using nowadays. Third one is gel. These have prolonged contact time like ointments and do not cause much blurring of the vision. Last one is aquarest. This forms system of drug delivery through membrane. These can be placed in the upper part. Fifth one is soft contact lenses in cases of corneal ulcer for antibiotics and antiviral. Periocular injection, subconjunctival injection, subtenuous injection, and retropulbar injection, and peribulbar injection. Next slide. Also intraocular injections, intracameral injection, which injections are pushed into anterior chamber, intravitreal that push into the vitreous cavity, and example of this Avastin intravascular injections. Next slide. Next slide. Commonly used agent, anti-infective agents like antibacterial, antiviral, antifungal, antiglycomic drugs, anti-allergic drugs, anesthetic drugs, viscoelastic, and dyes which are used in ophthalmology. Next slide. Next, antibacterial agents, mainly sulfonides, beta-lactam antibiotic, penicillins, and cephalosporins, aminoglycosides, streptomycin for TB, and gentamicin 0.3% eye drops, and tobramycin. Next, amikacin, neomycin, primycin, chloramphenicol. These are some antibiotics which are generally used in ophthalmology. Next, these are some charts showing the topical, subconjunctival, antivirals. Antivirals mainly use acyclovir, ganciclovir, trifluoromethadine, and valaciclovir, ganaclovir. These are some antivirals. Next, antifungals, natamycin, 5% topical, and fluoroconazole, itraconazole, ketoconazole are some antifungal drugs that use in ophthalmology. Next, ocular hypertension. These drugs are used in glycomimetic therapies. They are parasympathetics, metatic drugs, beta blockers, hyperosmotic agent, prostaglandins, calcium channel blocker. Next. Next, these are glycomimetic drugs. Next. These some are glycomimetic drugs. Next, mydretics and cycloplegics. Pupil and dilating drugs are called as mydretic drugs, and systematically used in routine cause pupillary dilation. Uses of mydretics during ECG surgery. Uses of cycloplegic in case of iridocyclitis, keratitis, endophthalmitis. In case of accommodative spasm, also mydretics should not be used in angle closure glaucoma. Next, onset, atropine, cyclopine, yes. Local anesthetics, topical and infiltrative, these main two types. Nowadays, topical is most of the preferred drugs. Lignocaines 4%, 2%, tetracaine 0.5%. Next, infiltrative anesthesia. They are including peribulbar injection, retropulbar injection, subtenuous injection, and mainly uses of lignocaine, bupivacaine, and Hyalase. Next, some steroids are there, and NCDS is there. They are shown in this chart. Next. These are anti-VEGFs injection, mainly used as a retinal surgeon or VR surgeon. Anti-VEGF agents are ranibizumab, pegaptimine, and bevacizumab. These are given in intravenous in case of CMOS. Next, lubricant agents. These are artificial tears, mainly used CMCs, 0.5 or 0.1 percentage, buffer like boric acid. Yes, next. Next, these are some preservatives and some Ayurvedic therapies are there. Tarpan, Ashotan, Bidalak, Parishek, Putpak, Anjan, and Pindi. Next. Next, these are some pictures that showing Ayurvedic therapies. Tarpan, Pindi, Bidalak, Ashotan. These are some Ayurvedic therapies. Next, Putpak, Sek, Paripak, Parishek. Next, Tarpan, Pindi. These are some Ayurvedic therapies that are used in Ayurvedic ophthalmology. Thank you.
Thank you, doctor.
Thank you, sir.
Next, I invite Dr. Priya for the poster presentation. Dr. Priya Nanapau Nanekar for the poster presentation. Dr. Priya, are you there?
Yes, sir.
Please share the
Sir, can
screen,
you
doctor.
please share my screen?
Okay, doctor, 1 second. I'll share for you. Doctor, please start the session, doctor.
Yes, sir. Good evening, everyone. Good evening, everyone. My name is Dr. Priya Nanekar, third year PG of Kumar Bhutta department from Dr. D.Y. Patil College of Ayurveda, Pune. Today, the topic of my presentation is Stanya, means breastfeeding importance. First, we will be discuss about the Stanya definition according to Ayurveda. Rasat Stanyam means Upadhatu of Rasadhatu is Stanya. Stanya is a prasad bhag of Rasadhatu, Madhura Rasa, and generated from digested food. According to the WHO and IAP, breastfeeding is the normal way of providing young infants with the nutrient they need for healthy growth and development. According to Charak Acharya, properties of normal breast milk means Stanya Sampat are Prakrut Vanis, Shankhavas and Pandura. Rasa is Madhura Rasa and Kashayanu Rasa. Gandha, Madhura Gandha. Sparsha, Himavata forms homogeneous mixture with water. Pushtikaram and Arogyakaram. Other properties are Pramana, 2 Anjali, Guna, Lagu, Virya, Shita, Vipaka, Madhura. Importance of breast milk. Breastfeeding must be started as soon as possible after birth, within 1.5 hours after normal delivery and 4 hours after cesarean section. Exclusive breastfeeding for 6 months and complementary feed can introduce after 6 months only. The baby should be given only breast milk and not even water for 6 months of life. Breast milk is the first vaccine for the newborn. Breastfeeding within 1 hour of birth develops health and bonding. Then composition of breast milk are water, protein, carbohydrate, vitamin and minerals, various fats, antibodies, other immune cells, and hormones. According to Ayurveda, Shira the period is about up to 1 year of age. Then Stanya Dushti. There are 8 Shira doshas are mentioned in Ayurveda. First, Vata Dushta Stanya. Symptoms are Vairasya, Fena Sanghata, and Roksha. Second, Pitta Dushta Stanya. Symptoms are Dorgandhya and Vaivarnya. Third, Kapha Dushta Stanya. Symptoms are Atisnigdha, Pichila, and Guru. Then we will discuss about Stanyadushti common treatment is Shodhan and Shamana Chikitsa, Vaman, Virechan, Astapan, and Anavasan Basti for mother. Type of breast milk. There are 4 types of breast milk. First, colostrum. Milk secretion during first 3 days after delivery is called as colostrum. Contains more antibodies, protein, vitamin A, D, E, and K. The second one is transitional milk. Milk production after 2 weeks contains fat and sugar, but low protein are there. Third one is mature milk. Fourth, preterm milk. And according to phase of feeding, there are 2 types, fore milk and hind milk. Okay. Thank you, sir.
Now I invite Dr. Akash Ramesh. Dr. Akash. Dr. Akash.
Hello, ma'am. Hello.
Hello, doctor.
Yes. Hello.
Doctor, please start.
Yes, ma'am. Share screen. Hello, ma'am. Hello. हाँ मैम आवाज स्क्रीन दिख रही है मैम? हाँ मैम my topic myself is Dr. Akash Ramesh Chaudhary. Hello.
Please start, doctor. You are audible, doctor.
हाँ ठीक है. आवाज क्लियर आ रही है क्या मैम?
Hello, doctor. Your screen is visible, doctor. Your audio is also clear, doctor. Please continue.
ठीक है. Hello. 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 हाँ मैम आपकी आवाज नहीं आ रही है. हेलो.
Hello, Dr. Akash.
हाँ अभी आ रही सर. Myself is Dr. Akash Ramesh.
Please.
PG Scholar Second Year, Department of Kai Chikitsa. Guided by Dr. Prashant Yavatkar sir, HOD and Associate Professor, Department of Kai Chikitsa. College name is Sri Vivekananda Nursing Home Trust, Ayurved Mahadalaya and Chikitsalaya, Rauri Factory, Ahmednagar. My topic is junk food habit as a risk factor in Grahani dosh in an epidemiological study. Introduction. In the recent year, there has been an unprecedented increase of incidence related to gastrointestinal system due to changing in lifestyle, diet pattern, behavior pattern, and mental stress and strain. One with such type of common gastrointestinal disorder is a Grahani dosha, that is a psychosomatic disorder caused by regular intake of junk food that weakness the digestive fire, and disharmony is a process between the digestion and absorption of body. Objective to conduct a survey study of junk food as a risk factor in a Grahani patient. Material and method. A survey study of total 2,000 volunteers was conducted at OPD, IPD, various camp of college, Ahmednagar, and certain junk food outlets. Voluntary were screened on the basis of prepared questionnaire. Result on survey study, various risk factors that are considered as significant for the selection of the new patient, like junk food user, including adequate, frequent, and regular, 60% problem after taking junk food, 60% heartburn, 38.8 delayed digestion of food, 55% fatigue and lethargy, 45.2% gurgling sound in abdomen, 52.8% tendency of flatulence, 34.4% alternate bowel habit, 29.2% disrupted routine, and 44% alternate Jarana Shakti, and 39.2% an alternate Abharana Shakti. Conclusion. Maximum prevalence was found in a patient leading sedentary lifestyle and emotionally disturbed patient were more prone for the disease. It was concluded that continuous intake of junk food is a risk factor for Grahani Roga rather than sometime intake of junk food. Thank you, ma'am and sir.
Thank you, Dr. Akash.
Welcome, sir.
Next, I invite Dr. Swapnil Vital Mali for the paper presentation. Dr. Swapnil, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
सर स्क्रीन शेयर हो रही मेरी?
Screen is visible, doctor. Please start the session.
My name is Dr. Swapnil Mali, Rognidan एवं विकृत विज्ञान डिपार्टमेंट SVNST Ayurved College Rahuri Ahmednagar Maharashtra. The topic is role of diet and lifestyle modification in the prevention and management of cardiovascular disease. Introduction. The incidence of lifestyle disease like hypertension, diabetes mellitus, dyslipidemia, and the overweight associated with cardiovascular disease is a one of rise. Cardiovascular disease continues to the major cause of mortality, representing about 30% of all deaths of worldwide. It is estimated that 80% of cardiovascular disease is preventable. Ayurveda is recognized as the foremost life of science and describe the way to prevent the management disorders. Ayurveda provides effective solution in the form of dietary regulation, lifestyle advisory, and detoxification procedure like Panchakarma. Etiology of Hriday Roga. Diet factor: Tikshna, Ushna, Tikta Sevan, Addeshan. Somatic factor: Shram, Vegadharan, Abhighatak, Ati Virechan. Psychological factor: Chinta, Bhaya, Trasa. Miscellaneous factor: Gada, Ticharya. Primary preventable lifestyle change and term-based care: cholesterol, tobacco, diet, type 2 diabetes, aspirin use, physical activity, high blood pressures. Dinacharya: Danta Dhawan and Jivarni Lekhan, Dhumapan, Tela Abhyanga, Vyayam, Snan, Anulepan, Ahar. Discussion: unhealthy diet, improper daily routine, weakness the body's immunity, and one of suffer from many serious diseases like cardiovascular disease. If the person adopt proper diet and systemic daily routine, then they can remain completely free from cardiovascular disease. Conclusion: therefore, the conclusion is that it has become necessary to improve the diet and lifestyle for prevention and the management of
cardiovascular disease. Very simply, daily routine change and lifestyle modification can help in prevention of cardiovascular disease. Thank you, sir.
Thank you, doctor. Next, I invite Dr. Mohini for the paper and poster presentation.
Yes, sir. Can you
Okay,
please
doctor.
share my slide?
Doctor, do you have any problem with screen sharing, doctor?
Can you please share my slide, sir?
Okay,
Hello?
doctor. Okay, doctor. I'll share for you, doctor. Just a second. Doctor, please start the session, doctor.
Hello, everyone. My name is Vaidya Mohini Bidve, PG scholar, Sanskrit Sahitya Siddhant Department, JSC Nagpur. My topic is Sadhguru Code of Right Conduct in Ayurveda for Healthy Life. Next. Next slide. Ayurveda means science of life. It is not only healing science, but a guide to live an ideal and healthy lifestyle for every human being in this universe. According to Ayurveda, health is balance of body, mental, social, and spiritual well-being. Main aim of Ayurveda, that is to maintain the health of healthy individual and cure the disease of patient. Next. Next. According to Ayurveda, everyone can enjoy a healthy life by following certain rules. Led by Ayurveda, these various rules are divided into Dinacharya, Rityacharya, and Sadhguru. These rules are very important in prevention of disease and promotion of ideal health. Next slide. References of Sadhguru in Vrutta, Charak Samhita, Charak Sutrastan Adhyay 8, Indriyok Kamya Adhyay, Sushrut Samhita, Chikitsastan Adhyay 24, Anaghat Pada Pratishedh Adhyay, Ashtang Hruday Sutrastan Adhyay 2, Dinacharya Adhyay. Next. Next slide. Need of study. Rapid increase in lifestyle disorder, stressful life, negligence towards personal health due to hectic schedule, diminishing moral values and ethics, increasing incidence rate of mental disorders, increase in the criminal and sinful activities. Next. Next slide. Modern era stressful life. Next. Next slide. Reason for lifestyle diseases: wrong eating habits, smoking, tobacco consumption, alcohol consumption, and physical inactivity. Next slide. Ayurvedic recommendation to achieve best lifestyle is by Dincharya, Rutucharya, Vegvidharan, Sadhguru, and Achar Rasayan. Next slide. Nirukti of Sadhguru. Next slide. Sadhguru. Sadhguru originates from two words. Sad means good and Vrutta means conduct or behavior or habits included in our daily regimen. Acharya Chakrapani in his Tika on Charak Samhita has explained that Sadhguru has doing the righteous, virtuous, physical, verbal, and mental conduct. Next slide. According to Ayurveda, to maintain a healthy and disease-free life, everyone should follow Sadhguru mentioned in Ayurveda text. Sadhguru plays key role in the maintenance of and prevention of disease. Sadhgurus are applicable to people of all age groups at all time and at all places. Next. Next slide. If someone ignores to follow this code of right conduct, then it leads to pradnaparat, which is the main cause of diseases. Therefore, one who decides to promote his or her own well-being should strictly follow the entire code of conduct fully, invariably, and cautiously. Next slide. Types of Sadhguru: Sharirik Sadhguru, Samajik Sadhguru, Mansik Sadhguru, Dharmik Sadhguru, and Ahar Sambandhi Sadhguru. Next slide. Sharirik Sadhguru: one should bath twice daily, one should clean excretory passages and feet frequently, one should have hair cut, shave nail cut thrice every fortnight, comb hair properly. Next slide. Apply oil daily to head, ear, nostrils, and feet. When coughing or sneezing, laughing, always cover your mouth. Do not pick your fingers in nose, teeth, and ear in presence of other persons. Next. Samajik Sadvrut, that is social conduct. Always take initiative while speaking to others. Keep smile on face always. Always be forgiver. Be compassionate to all creatures around. Envy in action of others, but not in reason. Be truthful. Console the frightened and be merciful to the poor. Next slide. Mansik Sadvrut, that is mental conduct. Be happy, be bashful and wise, be enthusiastic always, be controller of the intolerance, be tolerant towards the harsh words uttered by others. One should not be impatient or overboard. One should not neglect the maintenance of servants. One should not have non-reliance on his own man. One should not enjoy alone. Next slide. Dharmik Sadvrut, moral conduct, being spiritual, having faith in God. One should pay respect to God, cow, Brahmin, Guru, and elders. Honor the guests. One should not speak ill of the noble persons or teachers. One should not perform spell, worship God, trees, or do adhan while being impure. Next. Bhojan Sambandhi Sadvrut, rules regarding diet. That is, one should not take food without wearing ratna in hand or without bath or with torn clothes without offering to God. One should not take food without offering to ancestors, guru and atithi. Without washing, one should not eat without washing hand, feet or face or without cleaning mouth. Next. Don't eat facing towards north or don't eat with disturbed mind. One should not take curd at night. One should not eat stale foods except meat, raisins, dry vegetables, and fruits. Next. By following this Mansik Sadvrut, we can attain has Sattva increases, stress-induced disorder decreases, and mental diseases like anxiety, depressions are controlled. Next. Rules regarding diet. Wrong eating habits can cause Agnimanda, Ajirna, and gastrointestinal disorders. Next. Rules regarding natural urges like Veg, Dharan of Mal-Mutra Veg can cause Vadi of Adharya Veg like Adman, Vilmutra Vatsam, and Mutrashmari, and Mal Utsarjan at wrong place can cause infectious diseases. Next. Benefits of Sadvrutta. By following this Sadvrut, one can achieve the two aims together, that is Arogya means health and Indriya Vijay, that is control over sense. And by following this Sadvrut, one can attain Ayu, Arogya, Aishwarya and Yash. Next slide. Conclusion. Being kind to others, controlling action of body, mind and speech, and treating everybody like oneself is good conduct. If one follows these rules and regulations, he gets long and healthy life as well as wealth. Sadvrut with its components like Dincharya, Ritucharya, Achar Rasayan reduces the stress-related disorders, increases Sattva Gun, and decreases the health-related issues, including lifestyle disorders as well. So in order to live a long, healthy life and happily, we must follow Sadvrut by making it a part of daily regime. And in this way, the four Purushartha like Dharma, Artha, Kama, and Moksha can be obtained. Next. The need of R is to adopt code of conduct to every individual. Disease-specific advice of Sadvrut should be incorporated in the prescriptions. By obeying rules of Sadvrut, we can prevent disease and ailments among people and avoid mishappening in society. As it is said, prevention is better than cure. Thank you. Next slide. Thank you.
Thank you, Dr. Mohini.
Next is a poster presentation.
Yes, sir. Yes, sir. Can you share that too?
Okay, doctor. Dr. Mohini, please start the session, doctor.
My topic is Grishma Ritucharya. Kal, Adan Kal, that is mid-May to mid-July. Dosha, Pafashaman and Vata Sanchay. Deha bal is our bal, and Agni bal is also alpa. According to Ritucharya, our Acharya has described Ahar and Vihar, that is Patyahar. Let's see. Madhur Ahar to be taken or consumed is Madhur Shita, Drava Snigdahar, and Sattu mixed with sugar, water mixed with sugar, Shita Jala Gruta, Shalidhanya and Jungle Mass wearing up pearl, etc. ornaments, sleeping on terrace under moonlight, and visit the parks. Apatyahar, that is ahitkar ahar ahitkar to the body, which should not be consumed, is katu, that is spicy, amla, that is sour, lavan, that is salty, and ushna, that is heat. Heat generating ahar should not be consumed. Apatyahar. Then next is madhyapan. Limited use of madhyapan is told, but if needed, should be taken diluted with water. Apatya vihar, that is Vayam. Vayam is not indicated in Grishma Ritucharya. Along with that, Atap Sevan, that is exposure to sunlight and Vevai. Okay. Thank you.
Thank you.
Thank you, doctor.
So next I invite Dr. Shivani Rao for the paper presentation.
Yes, ma'am. 1 minute. Am I audible?
Yes, doctor, you're audible.
Okay, I'll share the screen. Is my screen visible?
Yes, doctor.
Good evening, everyone. I'm Dr. B. Shivani Rao, second year PG scholar in the Department of Dravya Guna Vijnana, Karnataka Ayurveda Medical College, Mangalore. I'll be presenting on understanding of Anukta Dravya in Ayurveda under the guidance of Dr. Swapna Bhatt. Bheshaj or drug is the tool for the physician and is described as the second most important factor for successful management of disease in Ayurvedic text. In spite of having detailed description of numerous drugs along with their properties and therapeutic usage, still many of the medicinal plants are not included in the Ayurvedic text as they are large in number. Acharya suggested utilizing yukti along with anumana to determine the properties of undocumented drugs. Anukta is un plus ukta, literally meaning is unsaid or unuttered. Anukta or nokta is a dravya which has not been said or documented in Indian samhitas or nigandus. The term Anukta Dravya means that the drugs which are available in this universe have to be studied for their morphology on botanical lines and to give a literary validation for identification on the lines of Ayurvedic philosophy for conversion and utilization. So what is the need of understanding this Anukta Dravya? Anukta Dravya is important because Acharya Charaka has mentioned Anena Upadeshena Nanaushadhi Bhutam Jagati Kinchit Dravyam Upalabhyate Tam Tam Yuktimartam Cha Tam Tam Abhipretya. There is no material which cannot be used as a drug or which is useless. Era of advancement in terms of new disease, that is the Anukta Roga, paves a way to explore or discover new drugs. Ethnobotanical studies or survey helps to understand or explore region-specific plants plus their folklore practices or traditional knowledge. So what is the methodology to understand this Anukta Dravya? First is the documentation through folklore. Information with respect to Anukta Dravya should be gathered by direct means through field survey from rural areas and surrounding areas of a particular region. Villagers, especially traditional healers, elderly people who are well acquainted with medicinal plants should be approached. Relevant information like the local name, useful part, form of use, dosage, vehicle, indication should be collected. Observation on habitat, habit, vegetation type, etc. The freshly collected specimen should be photographed, which exhibit the details of plant and will be helpful in visual identification of the species. Next is the comprehensive survey of the literature. Information related to Anukta Dravya like the botanical name, English name, family, morphology, and chemical composition should be gathered by indirect means through comprehensive survey of literature. On the basis of information gathered by fieldwork, comprehensive review of books, journals, and previous research work should be carried out. Computerized search of published and unpublished works related to this study. Then is the identification. After recording the local name, botanical identification has to be done. Expert opinion of plant taxonomist has to be sought for cross-checking and confirmation on identity. Then is the nomenclature. After identification, nomenclature of plants in Sanskrit has to be done prior to determining the name of every plant as per the criteria of nomenclature mentioned in Nigandus. Then comes the pharmacognostic study. The study of medicines or crude drugs from natural source is termed as pharmacognosy. It has played a pivotal role in the discovery and development of new drugs and therapies. Pharmacognosy is closely related to plant botany and plant chemistry, and indeed both originated from the earlier scientific studies on medicinal plants. Initially, the crude drugs were identified by comparison only with the standard description available. Due to the advancement in the chemical knowledge of crude drugs at present, evaluation also includes method of estimating active constant present in the crude drug, in addition to its morphological and microscopic analysis. The crude drugs can be identified on the basis of their morphological, histological, chemical, physical, and biological studies. Under this, there is macroscopic study and microscopic study, powder microscopy. Then is the physiochemical analysis like the loss on drying, total ash, acid insoluble ash, water soluble ash, HPTLC. Pharmacognostic study is the initial step to confirm the identity and to assess the purity and quality of the drug. The physiochemical parameters are mainly used in judging the purity and quality of the drug. The pharmacognostic study, physiochemical analysis, and HPTLC profiling helps in the standardization of the Anukta plant with respect to its identity and purity. Then comes the phytochemical study, like the test for alkaloids, carbohydrates, saponins, tannins, flavonoids, glycosides, phenols, etc. Presence of these phytochemicals with its safety data justifies the therapeutic value of the dravya. Then there is the safety studies. Toxicological studies are carried out to confirm the toxicity, lethal dose, therapeutic effective dose by animal experimentation. Then bioassay. The bioassays are performed by in vitro and in vivo methods to confirm pharmacological actions, toxicological studies, additional or unexplored pharmacological activity. Then comes the assessment of rasa panchak. So how to do this? Determination of the rasa. It is by two methods, rasa nipata method and taste threshold method. The rasa nipata method is the taste with tongue is the criteria for determining the rasa or anurasa of the drug. Select the drug for the study, identify it properly on botanical lines, determine the part to be used, collect the drug, allow it to dry up, make its fine powder by grinder. Select 25 healthy volunteers, preferably senior Ayurvedic students who may not make mistakes in expressing the rasa they pursue. Ask them to wash their mouth, allow 5 minutes gap between washing of mouth and tasting of the drug, serve 5 grams of fine powder of drug to these volunteers, give them chits and paper and request them to record the rasa and anurasa they pursue. The rasa which majority of the volunteers mentioned will be considered as the pradhana rasa. If the volunteers could mention any anurasa, it should be concluded accordingly. Then is the taste threshold method. There may be certain physiological variations in the taste perception power of different volunteers. When the taste of the drug is explicit, there shall be no difficulty or difference of opinion. But when two rasas manifest in a drug with equal intensity, both the taste may be perceived and it may be difficult to confirm which rasa is perceived initially. To resolve this difficulty as well as to determine the intensity of taste in a drug, taste threshold method will be useful. The rasa of higher taste threshold would be considered as the pradhana rasa. So the procedure is take 5 grams of the drug powder, put it in 100 ml of water and stir it for 30 minutes. Then filter it with a filter paper. Take 1 ml of that filtered solution and dilute it with the distilled water gradually. Take few drops of the solution between different dilutions. The point at which the taste is last perceived is the taste threshold of that drug. Any further dilution of the solution would reveal no taste. So this is the pro forma for the rasa assessment. For example, Madhura is assessed based on the Hladana, Mukalepana, Madhavata, Aksha Prasadana, Amla Rasa by Mukam Straveti, Dantaharsha, Akshi Bruvam Sankocheti, Romaharsha. And similarly, Lavana, Katu, Tikta, and Kashaya Rasa, they are assessed on these parameters. Then the determination of guna. The gunas inherent in a dravya can be understood by their rasa, applications, and biological responses. They can also be inferred by its own pharmacological actions. Then is the determination of virya. According to Acharya Charaka, the virya of a dravya is perceived through two means, that is adivasa and nipata method. Here adivasa means after knowing the karma done by the dravya, inferring its virya. Nipata means direct perception of the virya through sense organs. When a dravya comes in contact with any of the sense organ, it is grouped under nipata. Acharya Charaka has said that the virya of a drug is to determine from the action it produces in the body, right from its coming in contact with the tongue till its excretion or elimination from the body. Thus, all the pharmacological actions of the drugs are explained by virya. This is the pro forma to assess the virya.
So reaction in distilled water, in Ushnavirya it will be exothermic, in Shitavirya endothermic. Reaction in artificial gastric juice, exothermic in Ushnavirya, endothermic in Shitavirya. Appetite, BP and BMR will be increased in Ushnavirya. Sleep and urine will be increased in Shitavirya, and stool will be difficult to pass in Ushnavirya, and it will be smooth evacuation in the Shitavirya. Then is the determination of Vipaka. According to Acharya Charaka, the taste of a substance is felt at the commencement only, that is when the substance comes in contact with the tongue, but the post-digestive changes are felt only when the final effects of digestion are produced. Vipaka is inferred from the action it produces in the body. The Katu Vipaka formed on post-digestion promotes the Vata, and it causes the decretion of the semen and the suppression, that is difficulty in the passage of the feces and urine, while the Madhura Vipaka is promotive of Kapha dosha, and it causes the increase of the semen and easy elimination of the feces and urine. The Amla Vipaka formed on post-digestion promotes the Pitta dosha. It decreases the semen production and promotes the elimination of the feces and urine, that is the easy evacuation. Same thing is explained in this chart form. So there is a need for synthesis of contemporary and Ayurvedic knowledge, which will help the future generation to use Anukta Dravya, the ignored medicinal plants of great value. The incorporation of these very popular folk medicines and exotic plants into Ayurveda and in therapeutics would fill the gap in Ayurvedic pharmacopoeia, where the classical drugs are facing the problems of scarcity. Thank you.
Thank you, Doctor. Now I invite Dr. Asmita.
Yes, ma'am. Actually, I was given 9:21 time. So is it Asmita Kardile?
Sorry.
Doctor. Yes, doctor.
Yes, myself, Dr. Asmita Kardile. I was given 9:21 time. So is it me, like, or there is any other Asmita?
No, doctor, it's
No,
you.
no, the doctor. It's you, doctor. No, the Asmita, doctor. It's
Okay,
you.
I'll share my screen.
Okay, doctor.
Is my presentation visible?
No, doctor. Now
Now
it's
visible, doctor.
Is it visible now?
Yes, it's
Yes,
visible
doctor.
now.
Please start the session.
Okay. Good evening, sir and ma'am. Myself, Dr. Asmita Kardile, final year PG student of Stree Roga and Prasuti Tantra, Siddhakala Ayurved Mahavidyalaya Sangamner. I'm going to present my topic through a case study on significantly rising disorder amongst women, that is Vandhyatva, and role of Ayurveda in management of Vandhyatva with special reference to infertility. So I'll begin with the introduction. Acharya Charaka stated that one who conceived Garbha is Stri and other all remaining Stris are Vandhya, while Acharya Shushruta said Stri having no Artha Pravritti is known as Vandhya. The hetus of Vandhyatva are Janmottar Vikruti, Dushti in Ambu, Bij, Kshetra, Vayu, also due to Sankoj in Garbhashay, Artavayi Dhamni Avrod, stress, Yoni Vyapat, Rajo Dushti, various Yoni Rogas all lead to Vandhyatva. Sushruta explained Artava Srotas with the Lakshan is Vandhyatva. In Ayurveda, Harit Sanhita explained 6 types of Vandhyatva. Nowadays, it has become very common disease among women and men due to improper lifestyle. Therefore, first treatment for that is Shuddhi of Deha, and it is done by Shodhan Chikitsa. Vaman, Basti, Uttar Basti are very useful in management of infertility. So the aim is to study the role of Ayurveda in management of Vandhyatva with special reference to infertility. Objectives are to study the effect of Shodhan Chikitsa and Shaman Chikitsa in the management of Vandhyatva with special reference to infertility. The case report is 23-year-old female patient came with the complaints of irregular menses since 4 to 5 years, dysmenorrhea, backache, unable to conceive Garbha. Patient's Nidan was done initially along with Nidan Pancha, Ashtavid and Dashavid Parikshan. On examination, hetus as explained by her, Aharaj hetu, milk, pickle, ice cream, she used to consume that, oily foods, dadhi, papad, soft drinks, etc. Viharaj hetus were Divaswap, Avyayam, Vegadharan, Ratri Jagran. Manas hetus like stress, early marriage causing depression, ati chinta, etc. After performing her general examination, she had malabaddhata, alpa samajiva, and other vitals were normal. On taking her personal history, Dinacharya explained by her, she used to wake up at 6 to 7 o'clock, but no regular exercise, ruksha, ushna, tikshna ahar sevan, spicy green vegetables, fast food ati sevan, divaswap, ati chinta, krodh, etc. She was all right before 4 years. She took allopathic treatment, but she didn't got significant relief and was diagnosed with PCOD. She had no any history of trauma or any other major illness. Was diagnosed with PCOD. In the management, Pachan Chikitsa was given. Am Pachak Vati 250 mg, Purva Bhakta, that is twice before meal, twice a day before meal, with Anupan of Koshnajal. In Shaman Chikitsa, Chandra Prabhavati was given 250 mg, Purva Bhakta, that is twice a day before meal, with Anupan Koshnajal. Vasant Kusumakar was given 250 mg, Adho Bhakta, that is after meal, with Anupan of Koshnajal. In Shodhan Chikitsa, Purva Karma like Snehapan, Sarvanga Snehan, Sarvanga Svedan was given. Snehapan was done with Falagrit with rice in 30 ml quantity up to Sneha Siddhi Lakshan. Sarvanga Snehan was done with Abhyanga Tel for 20 minutes, 3 days. Sarvanga Svedan was done with Dashamul and Nirgundi and followed with Vaman and Uttarbasti. Uttarbasti was given for 7 days. After Snehapan, Vaman and Uttarbasti, she had regular menses, her cycle got normal, mild dysmenorrhea and backache. Along with treatment, proper dinacharya, pathya, apathya was followed by patient. In ahar, grita, tailapan, godhum, shashtikshali, mudga, mulak, draksha, carrot, takrapan, green vegetables were advised. In Vihar, she was advised to perform daily exercises, vyayam. No divaswap was advised. Also apathas like to avoid pickles, ice cream, etc. In the observation, her cycle got normal. There was significant relief with dysmenorrhea. So in this study, observations were done before and after treatment based on symptoms and after Shodhan and Shaman Chikitsa. Vandhyatva is mainly caused due to avrodh of Vata and Kapha dosha. Snehapan of Falagrit is given for 3 days up to Sneha Siddhi Lakshanas. Snehan and Svedan also done for 3 days before Vaman. So we concluded that in this case, all symptoms like irregular menses, backache, dysmenorrhea were markedly diminished in 3 months study. In conclusion, Snehapan, Vaman, Uttarbasti, Shaman Chikitsa are significantly effective in Vandhyatva, followed by proper Dinacharya, Pathya and Apathya. That's it. Thank you.
Thank you, Doctor.
Thank you, Doctor.
Thank you.
Now we invite Dr. Abhishek Jalandhar.
Yes, ma'am. Hello, madam.
Your
Yes,
screen
Doctor.
is visible, Doctor. Please
Okay.
start the session.
Okay. Myself, Dr. Abhishek Jalandhar Chakor. I'm a second year PG scholar from Panchakarma department, PMT Ayurvedic College, Shevgaon. And my guide is Dr. S.R. Gandhi. My today's topic for paper presentation is Ayurvedic Management of Saulya, Obesity, a Case Study. Saulya is described by Acharya Charak in Ashtavanandit Purish Adhyay, and its definition given by Charak is Medo Mausa Atiruddhatvacha Speak Gudar Stanaha Ayato Upchaya Utsaha Naro Atistula Uchate. That is Vruddhi in Med Mausa Dhatu, which leads to deposition of fat in abdomen, buttocks, and breast region, which cause less energy while doing work in the patient. And its treatment is given as Vatagnya Anna Panani Shleshmo Medo Harini Cha Ruksha Ushno Bastya Tikshna Rukshanya Udvartanani Cha. That is Vatagna Kapha Medohar Ahar and also Ruksha Ushna Tikshna Basti along with Ruksha Udvartan. Obesity, as defined by modern medicine, Definition: obesity is accumulation of excess fat in the body, which may lead to negative effect on health, reduced life expectancy, and/or increased health problems. Causes of obesity: increased intake of energy-dense food that are high in fat, carbohydrates, overeating and irregular food habits, lack of physical activity, and daytime sleeping. Symptoms include breathlessness even on little exertion or after physical activity, lack of interest in doing work, and excessive hunger. My case study includes a patient whose age is 42 years, male patient, having no history of diabetes or hypertension or any other major illness. His height was 1.61 meter and weight 80 kg. BMI is 30.9, which comes under obesity class 1, which we will discuss further. Waist circumference was 94.7 centimeter, hip circumference 96.5, and waist to hip ratio 0.98. Patient has following complaints: Shwasadikya, that is dyspnea on exertion; Nidradikya, 9 to 10 hours of sleep every day; IS Akshamta, that is he avoids heavy work; he was lethargic; also Balahinata, that is weakness after doing any work; Atik Sudha, that is more meals, that is 5 to 6 meals per day; and Ati Trushna, that is 4 to 5 liters intake of water every day. Ashtavid Pariksha was following, that is Nadi was 86, Mal twice a day, Jiva Swam, and all other, and Akruti was stool. Classification of obesity on the basis of BMI, that is severely underweight, which is less than 16.5 kg per meter square. Underweight is between 16.5 to 18.4. Normal weight is 18.5 to 24.9. Overweight is 18.5 to 24.9. 25 to 29.9. Obesity class 1, 30 to 34.9. Obesity class 2, 35 to 39.9. And severe or morbid obesity, that is class 3, which is more than 40 kg per meter square BMI. Treatment of our patient included Udvartan with Triphala and Musta for 8 days. In Basti, we used Anuvasan Basti with Til Tel and Lekhan Basti according to Karma Basti Yog, that is for 16 days. Shaman Chikitsa, the Arogyavardhini Vati, 2 tablets TDS before food with warm water, and Triphala Gugul also 2 tablets TDS before food with warm water. The contents of Lekhan Basti were as following, that is Makshi, that is honey 50 ml, Lavan 5 gram, Sneha of Til Tel was used 120 ml, Kalka Pukshadi Ganadravya, which includes Sendav, Shilajit, Kasis, Pushpakasis, Hinga and Tutta of 25 gram, Kashaya of Triphala Kwat was used 200 ml, Gomutra 80 ml, which was total quantity of 480 ml. And schedule of Basti Kram for 16 days was first 2 Anuvasan, then alternate day are Niruva and Anuvasan, and last 3 Anuvasan Basti with Tirte. Niruva means Lekhan Basti was given to the patient. After this is the improvement of signs and symptoms and other characteristics on 16th day and on 13th day. Weight was reduced from 80 to 75 kg and then further up to 72 kg, that is 8 kg weight loss. BMI also decreased from 30.9 to 27.8 at after 1 month, that is from obese class 1 to slightly overweight only. Waist circumference, hip circumference also decreased. Other symptoms also like Shwasadikya, Nidradikya, Ayasamsha, Jadya, Balahinta, Atikshuddha and Atishrutna, which were 2+, 3+, they were decreased to 1+, or some of them like Shwasadikya, Balahinta and Atitrushna were not seen in patient after 30 days. These are the before treatment and after treatment, that is after 30 days images of the patient. We can see the weight loss on abdomen region. Discussion. Efficacy of Lekhan Basti on Staulya Rog. Lekhan Basti is especially a Tikta Shodhan Basti and it is indicated in Bahudosh Avastha, which includes Medo Vruddhi. It removes vitiated doshas from whole body, thus causes Shroto Shodhan. It makes the further removal of doshas from the body, hence breaks the Samprapti of Medo Dushi and helps in Staulya Rog. Use of Udvartan on Staulya Rog. Udvartan is having gun or Kapha Meda Vilayan property. As in Shloka also it is given as Kapha Meda Vilapayam. The virya of medicine enters the body due to Ushna and Tikshna gun of Dravya and its powerful influence on Romaku. It then opens the Mukh of Sira, resulting in Pak of Kapha and Medas. As a result of this, there will be Dravata Vidrati of Kapha and Medas, and it helps in decreasing Staulya. Conclusion: in this case study, 8 kgs of weight loss is observed with significant decrease in signs and symptoms within 30 days duration. They also combined use of Rukshan Chikitsa, that is Udvartan, Basti Chikitsa, Lekhan Basti, and Shaman Chikitsa gives remarkable changes in Staulya, that is obesity. Thank you.
Thank you, doctor.
So next I invite Dr. Prajna Baban Chavan. I invite Dr. Prajna Baban Chavan.
Next, I invite Dr. Madhuri for the poster
Hello.
presentation.
Hello.
Hello.
I'm Prajna Chavan.
Okay, doctor, please share the screen, doctor.
Hello. Am I audible?
Yes, doctor, you're audible. Please share the screen.
1 minute. Can you please share my slide, please? Hello.
Okay, doctor, just a second, doctor. I will share for you. Please start the session, doctor.
Okay. Good evening, everyone. Myself, Dr. Prajna Chavan, PG Scholar, Kai Chikitsa Department from Siddhakala Ayurved Mahavidyalaya, Sangamner. Today, I will present a single case study on effective management of Dadru Kushta according to Ayurveda, under guidance of Dr. S.J. Mane sir and Dr. S.D. Ure sir. Introduction: skin is the largest organ in human body. All skin diseases in Ayurveda have been explained under heading Kushta, are further classified into Mahakushta and Kshudra Kushta. Dadru is the type of Mahakushta according to Vagbhat and Sushruta, and Kshudra Kushta according to Charaka. Next slide. According to Acharya Charak and Vagbhat, Dadru Kushta is a Pitta and Kapha Pradhan disease, and according to Sushrut, it is a Kapha Pradhan disease. My references are Charak Chikitsa, 7 chapter, 23rd shlok, Ashtang Hridaya Nidan Sthan 14 in 24 shlok, Rasratna Samuchay 20 chapter, 106 to 108 shlok number, Ashtang Hridaya Chikitsa 8 chapter and 55-56 shlok, and Rasa Tarangini 8 chapter, 81 to 86 shlok number. Next slide. The present case study is an Ayurvedic approach in the management of Dadru Kushta. The case report is a 42 years old female patient with no any comorbidity, came with complaints of reddish lesion on skin over epistomal line, itching and burning sensation on that side. My patient operated for Hello. Hello.
Yes, doctor.
Next slide, please. On examination, it was found that general examination is moderate. Temperature of febrile, pulse 86 per minute. Oxygen saturation is 98%. Pulse 86 per minute. Blood pressure 120 by 70 mm Hg. Respiratory rate 20 per minute. Her weight was 66 kg. On systemic examination, it was found that RS, air entry bilateral clear, CVS S1 S2 normal, and central nervous system conscious and oriented. Next slide. In Ashtavid Parikshan, I was examined the nadi, which was kapha pradhan pitta, and pulse was 86 per minute. Mal was asamyak, mutra samyak, jiva ishat sama, shabda spashta, sparsha prakrut, druka prakrut, and akruti madhyam. Next slide. Treatment. The patient was advised internal administration of Arogyavardhini Vati, Gomutra Haitaki. In dose, Arogyavardhini Vati 500 mg twice in a day with lukewarm water for 14 days after meal. And Gomutra Haitaki 500 mg twice in day with Koshna Jal for 14 days after meal. And for local application, I was given her Kandakadi Madhar twice in day for local application. Pathya. The patient was advised to follow diet and lifestyle measures mentioned for Kushta, such as green gram, shali, tiktaras like patol and methi, and wear dry and clean clothes, and avoid immediate sleep after taking food. Avoid diet like mixture of milk and fish items, jaggery, salty, sour things, etc. Next slide. On the basis of improvement in objective and subjective parameters such as changes in size of lesion, number of pidka, reduction in frequency of contour, reduction in redness of lesion, I made the diagnostic assessment. In this slide, I was shown that sign symptom like Kandu absent in grade 0, mild itching in grade 1, moderate itching in grade 2, and severe itching in grade 3. And in Pidka, grade 0 absent Pidka, in grade 1 to 3 Pidka are present, grade 2 4 to 6 Pidka, and in grade 3 more than 6 Pidkas. Raga, in grade 0 normal skin color, in grade 1 faint normal, in grade 2 blanching plus red color, and in grade 3 red colors. Size of mandala, in grade 1 0, in grade 1 to 5 centimeters are mandala, in grade 2 6 to 10 centimeter, and in grade 3 more than 10 centimeter. Next slide. Observation and result. Assessment before, during, and after the treatment. Kandu was found before treatment, third grade. On 7th day, it is decreased to second grade, and on day 14 is 0. Pidka on 0th day, third grade, on 7th day 1 grade, and on day 14 0 grade. Raga on day 0 third grade, on day 7 second grade, and on day 14 0 grade. Size of mandala on day 0 second grade, on day 7 first grade, and on day 14 0 grade. Next slide. These are the picture before treatment and after treatment. These are shown in figure. Next slide. Result. Arogyavardhini Vati, Gomutra Haitaki, and Gandhakati Malahar showed excellent result in Dadru Kushta. This treatment gave appreciable result in the form of decreasing symptoms like Kandu, Pidka, Raga, and mandala size. Next slide. Discussion. Arogyavardhini Vati possesses Pitta Virechak, Tridosh Shamak, Deepan, Pachan, Kushtagna, Kandugna property. Due to this, it helps balancing Tridoshas and causes Agnivardhan, Bhedan, Malashodhan, Vatanuloman, Kushtagna, and Kandugna, which help in breaking Samprapti of disease. Gomutra Haritaki has Mrudu Virechak property. So Gomutra Haritaki is used for Nitya Virechana, which helps in elimination of vitilated dosha. Gomutra enhances its potency and also helps in Virechana. Next slide. Gandhakadi Malhar helps to breaking Samprapti. It has antifungal, antimicrobial, anti-inflammatory properties. Also regulate excessive sweating. It helps in detoxification and tissue repair. hence can effectively reduce the infection and prevent recurrence by improving immunity of skin. Next. Conclusion. From this case study, it can be concluded that Arogyavardhini Vati Gomutra Hetaki for internal and Gandhakadi Madhar for local use given in Ayurvedic text really effective in management of Dadru Kushta. Moreover, even after the discontinuation of treatment of patient had no complaint for recurrence of symptoms. Hence, this study can be continued on more patients for betterment of result. Thank you.
Thank you, Doctor. Next is a poster presentation by Dr. Mayura. We invite Dr. Mayuri.
Yes, ma'am.
Dr. Madhuri, please share the screen, Doctor.
Sir, can you please share the screen, that poster?
Okay, Doctor. Just a second, I'll share for you.
Yes.
Doctor, please start the session, Doctor.
Yes, sir. Good evening. I'm starting my presentation on Atma. Okay. Atma is in Ayurveda, Ayu is nothing but Chaitanya Vritti, that is continuity of life. Only till the time the body has Chaitan Atma, that is soul, it is said to be living. The factor that pervades all over the body or the world is known as Atma. And the word Atma derived from the Apadhatu, meaning which spread all over and moving forever respectively. Meaning of synonym of Atma is proficiency of knowledge. Proficiency means high level of skill of knowledge and no addition of vikara or dosha, superior, supreme, not destructible, controller, and the cause of creation, pervading spread in entire universe, closely associated with mind, cause of origin of life, and knower of everything which resides of body. Types of Atma by Ayurveda. That is 3 types: Jivatma, Paramatma, and Adhikaran Purush. Aims is to study the importance of Atma in the perspective of important sign of life. Second slide, please. Yes. Discussion. Movement of Atma from one body to another. The Ahankara, Dehantar, Gati, and Chaitanya are due to Atma. Atma is present in all our body in each Anu. The origin of Atma is impossible to trace due to its eternity. Jivatma is considered to be lesser energetic in comparison to the Atma. Paramatma is considered to be superior among all the souls. Atma is the deepest part of you, that is part of divinity itself. And yes, conduct as the self, Atma, Chaitanya, Charitra Vritti means to prevail as the knower and seer in absolute bliss. Thank you.
Thank you, Doctor. Now we invite Dr. Sandesh Arun for the paper presentation.
Hello, ma'am. Please share screen. Screen share.
Dr. Sandesh.
Hello, yes, ma'am.
Doctor, do you want to share the screen? Doctor, please start. It's visible now.
Doctor, please unmute and start the session, doctor.
Hello, ma'am. Hello, ma'am.
Yes,
Please start
doctor,
the
you
session,
are audible.
Dr. Sandesh Tonge from PMT Ayurved College, Roga. My guide name is Dr. B.T. Shinde, sir, from Kaichikitsa Department, PMT Ayurved College, Roga. My today's paper presentation topic is Chaturvida Sadhanopaya in Arshi Chikitsa. Introduction. Acharya Shushwat has mentioned various treatment modalities in Arshi Chikitsa. Aim and objective to study the Chaturvida Sadhanopaya in Arshi Chikitsa methodology, collection of data related Arshi Chikitsa as mentioned in Shushwat Samhita. चतुर्विध साधन उपाय तद्यथा भेषज शस्त्रशाराग्नि मिति. Arshi Chikitsa divided into 4 types. First is Bheshad Chikitsa, second one is Shar Karma, third one is Agni Karma, and fourth one is Shastra Karma. Conclusion is that Chaturvidha Sadhanopaya are effective in effective stated by Acharya Shushruta.
Dr. Sandesh?
Yes, ma'am.
Is it over?
It is over, madam.
Okay, thank you, doctor.
Next is the paper presentation of Dr. Sandesh. Dr. Sandesh, I will share for
Yes,
you,
yes.
doctor. Please start the session, doctor. Hello, Dr. Sandesh, please start the session, doctor. The screen is visible. Please start the session, doctor.
Hello, sir. My today's paper presentation topic is Manas Roga. Second slide, please, sir. In Ayurveda, Ayurvedic text, clear classification of mental disorders is not mentioned in systemic manner. Acharya Charaka has described Unmadapas Maratha etc. in described in Manas Roga. For the treatment, Mansik Vyadhi can be classified according to dosha involvement in state of manifestation. They may be involved into 2, only Mansik specific, Vikara and Vegas of Manas, and Ubhayatmak, Shirasa and Manas, Manas doshas. Second slide, sir. Monoadhisthana Mansik Vikara, mental disorder where the monodoshas are only basically involved. For example, Klama, Krodha, etc. Nanatmach Manas Vikara, endogenous mental disorder caused by specific types of Shirasa doshas. Example, Tantra, Brahmai, etc. Shira Manas Adisham Rogas, mental disorder where the both Sharirik as well as Manas doshas are basically involved. For example, Unmad Apasmar, etc. Mono Sharir Atad Vinesh Manas Rogas, disorder basically caused by the monodosha, subsequently leading to the involvement of the Shiras doshas, for example, Shukra Jora, etc. Next slide, sir. So next slide. Unmat, basically Unmat Samprak. So next slide. Unmat Samprak. Alpha the individual including Nidan Sevan, Maladushta, बुद्धीचे निवासस्थान असलेल्या स्थानाच्या ठिकाणी अधिष्ठान मनोस्रोत शिरोमित होऊन स्रोत दृष्टी करून उन्मादाची निर्मिती होते. नेक्स्ट स्लाइड सर. लक्षणादी दिविभ्रम सत्व परिवर्तन त्यानंतर आता मेष अल्पबुद्धीत वाक्यत्व, हृदय शून्यता, पर्वतवर्ग, दृष्टी अधीरता. नेक्स्ट स्लाइड सर. क्लासिफिकेशन ऑफ उन्माद अकॉर्डिंग टू शुरक अष्टांग हृदय, वाताची उन्माद, पित्ताची उन्माद, कफाची उन्माद, त्रिदोषाची उन्माद, मानसिक अकॉर्डिंग टू चरक, वाताच्या, पित्ताच्या, कफाच्या, सन्निपाताच्या अँड आगंतुच्या. नेक्स्ट स्लाइड. Yashaspamar definition found in Yasho means females. The soft-hearted in soft-hearted males also occur during the menstruation. This disease occurs mainly in females. After the menstruation, this disease may resolve automatically. Next slide, sir. Next is Madhumursha and Sannyas. Madhumursha Sannyas are because of the Dushi of Rasa Rakta and Sadhya Srotas due to variation Raja and Tamagun. Madhumursha Sannyas, these are the Uttarottar Balwan Rogas. Mad Sukha Dukha Vecha, state of loss of consciousness of Sukha and Dukkha. Next slide, sir. Mother, the word mother there corresponding to means the mother, any exhibiting and interrupting condition. Adatte, suffering. Hence the suffering from the toxic thing also known as madatte. Mother. Next slide, sir. Next is sannyas. Sannyas is several state where the patient does awake and does not cure without medicine. Ayurveda doshas causing irritation in the action of vak, deha and manas. Sannyas is caused due to the doshas, which are the hair, which are the hello.
Yes, doctor.
Hello?
You are audible, doctor. Please continue the session, doctor.
Atata and Vesh is made of the two words having meaning. Atata, the result falls on elementary having no exist, having no ingredient. Next, next treatment of the manas doshas according to Ayurveda. Generalization. The Ayurvedic approach is a holistic approach due to the importance of the pharmacopathologic panchakarma intervention. Is this. The first is the Upashya Chikitsa. Then there is a next slide, please, madam. Dhir Dhere Matadi Vidyan Manaushadam Param. That is next one is Satwa Vajay. Then Yukti Upashya Chikitsa Yoga. Satwa Chikitsa means according to mind and such in such a way that not acceptable. Hello. Hello.
Doctor, you're audible. Please continue.
Then Yukti Prasesha, this treatment through the logical use of medicine and modification or the R.V.R. in suit to needs of the person. The patient should be encouraged to follow the proper dietary regimens, follows the rules of Vrutta, use medicine which boosts the doshas, Aushadha, medicine to control the imbalance in mind. Yoga and mental health. Acharya and Bhagandar, while prescribing the principles of the treatment of Manas Rogas, having mentioned the importance of yoga, prevention of treatment in mental health. Acharya Charaka, Asojya Jnana Dhanya, Dhairati Smriti, Acharya Bhagavad, Dhiri. It's over, ma'am. Now it modern Ayurveda जे होते ते सम झाले मॅडम. Hello, am I audible, madam?
Yes, doctor.
आयुर्वेदिक जे होतं ते झाले मॅडम, ओव्हर झाले स्लाइड. हेलो.
Yes, doctor.
हाँ मैडम, आयुर्वेदिक स्लाइड जो थे वो अभी हो गए खत्म, ओवर हो गए.
Is this not the slide, doctor?
Not. Hello.
Second, doctor.
Hello.
Doctor, just a second.
Oh.
Hello, doctor.
Yes, sir. Sir, my slides are over now.
Okay, doctor. Thank you, doctor.
Oh.
Thank you for the session.
Thank you so much. Thank you so much.
I think today's presentations are come to the end. Dr. Sai Om Prakash, are you there? Dr. Sai Om Prakash Vakmare, are you there? Okay. Thank you for all presenters in this session. I would like to invite Dr. Aishwarya for the session.
Thank you, Dr. Sabin. And today's presentation is going to an end now. Next presentations will be on June 27th and 28th. And before winding it, I would like to extend my sincere gratitude to our panel members. And I would like to congratulate all the participants for your active participation. Meet on 27th. Good night.